2026 on nevadamedicaid.nv.gov and on May 7th, 2026 on notice.nv.gov. Please refer to the engaged feedback checklist from our first meeting. And we'd like to remind all BAC members that this is a safe and respectful place for everybody. Agenda item 2, disclosure of any conflicts of interest. Conflict of interest occurs when a member of the voting body has personal interests such as financial ties, gifts, or close relationships that could affect or appear to affect their ability to make impartial decisions. So please disclose any conflicts of interest you have at this time. All right, let's move on to roll call. Do we have Administrator Ann Jensen? I believe she's in a meeting and joining us
shortly.
Okay, let's move on to Bill Sims.
Present.
Azraela Gravel.
Present.
Jessica Funderburg. We have Jessica here. Okay, Kaylani Queen.
Present.
And Grace Larkins. I'm here. Jonathan, have we met quorum?
Yes, we have a quorum, Chair.
Thank you. All right, moving on to agenda item 4, public comment. If you would like to make public comment, please raise your hand or type public comment in the chat and enter the last 4 digits of your phone number, and your name will be called on to begin. So please state your first name and last name at the beginning for reporting purposes, and you will have 3 minutes to speak. Do we have any public comment in the chat?
No public comment in the chat.
Thank you, Jonathan. Okay, agenda item 5. We'll be looking at the March meeting minutes, and they were sent to the council members on April 16th, 2026 via email for review. Is there any discussion on the minutes at this time? Okay. I'd like to call for a motion to approve the meetings from the minutes from the March meeting.
All motion to approve.
Okay, Bill Sims, and a second.
Motion to approve. Kaylani Queen. Great.
Thank you.
To a vote, so you can do roll call. Or you can ask Jonathan to do roll call for a vote.
Oh, great. And Jonathan, can you do a roll call
Yeah.
vote, please, for me? Thank you.
Bill? Yeah. Azraela?
Yes.
Kaylani?
Present.
Then Grace?
Yeah.
The motion passes.
And the motion passes. Thank you.
Hey. Hey, everyone. How's it going?
Good, thank you.
Hey.
Okay, we're joined by Administrator Ann Jensen. And we can mark her as present in our roll call, please.
Oh, right now. Okay. Good timing. No, that's fine. I'm so sorry to be late. Okay.
No problem.
All right. Can folks hear me okay online? Hopefully, yes. Thumbs up. Okay, we'll go ahead and get started. Good morning, everyone. I'm sorry to be late. I was crashing in someone else's office for a quick morning meeting. So thank you for having us here, Heather. We're really glad to be space. So Thank you all for making the trip, for those coming from North, and for making the trip. I know it's often equally as far sometimes within Vegas to get to these places. So thanks for being here. As always, we'll start with really what is an overview of kind of what's important here in our Medicaid world, what we're focused on right now. Good news is we're going to spend a lot of time on each of these through our presentation items. So this will be a little bit more high level, but want to make sure that you all have a chance to really hear from us what we're focused on and what is a very busy time. So our top three are number one, focusing on the federal changes to Medicaid and preparing for those. Number two, working on our state legislative implementation from last session and preparation for next session. We have feet in kind of both worlds right now. And then our third piece is, of course, children's behavioral health that I continue to work there. So on the federal rules side, Chloe and I will talk through in a lot more depth the changes on the eligibility front. But as we've talked about in this meeting, there are a number of things changing for a specific group of our Medicaid recipients, starting in really this fall, but especially in January. There's a lot of different changes that are hitting at different times. We'll talk through in depth what that looks like, but fundamentally, there's a lot we're doing to prepare, and there's a lot we're doing to understand what our expectations are. So the law passed last July, and we just got the rule, so kind of the little bit more detail on how states are expected to implement this from our federal partners on Monday. It's 387 pages. So we've been doing a lot of reading over the past couple of days to digest that and make sure that the way we're preparing for these changes is aligning with what those expectations are. So I won't go into much more depth there just because we're going to talk about that in our agenda item coming up, which I'm excited for. So a lot more to come on that front, but know that that is a top focus for us. Our goal is to help people wherever they're eligible to maintain coverage for Medicaid. And if they're not, to connect them with other insurance products we're available to. So everything we're doing is in that vein, and you'll hear a little bit more about that soon. On the state legislative side, we're continuing to plug along with our implementation progress for all the 34 bills from last session. And then a lot of work we're doing is preparing for next session. So there's a really long process that begins almost the minute that one session ends, where we start beginning for the next one. And so we're in the thick of budgeting for our program for the next biennium. So the way this works in Nevada, we make budgets on a 2-year cycle. And so we're preparing our budget for July 2026 to June 2028. And if you can imagine, for folks that are budgeting for your own finances, projecting over 2.5 years in advance is a lot. There's a lot we need to plan for and think through. So it's a really deliberative and thoughtful process we go through to identify what we want to bring forward as additions to our program, to our staff, and to our work. All of that is confidential until the governor's State of the State address, where he unveils the governor's budget, which will be in January of this year, right before session starts. So we won't be able to get into the weeds of our budget items or legislative components until that time with this group, but in the early 2027 meetings, we'll be happy to go into detail there. But know that pretty much all teams within Medicaid are working hard to prepare for that budget process. That's my second one. And then my third is, of course, as always, on children's behavioral health. There's a lot we're doing to continue our work to support kids, both long-term by building a system that better works for kids and families, and in the short term to really support people navigating our system right now. So I'm really grateful. Heather and her team are growing. We got some new positions included to really grow what is a specialized care coordination team that's intended to support kids that have complex behavioral health needs and may need some extra support navigating all of our systems. That team is also working to implement what's called our reentry program, but helping kids that are engaged in our juvenile justice program get access to healthcare and behavioral health services before they return to the community, and helping that transition be good. So a lot of work we're doing there. Our next working group for children's behavioral health is a week from tomorrow, June 11th. So if folks have any questions or want to dig a little bit deeper, we'll be covering a lot of good things in that meeting. And as always, welcome. I know, Azraella, you're part of that group. And as always, welcome anyone to join that and participate if you just want one more meeting with us, because we love having you. So with that, I'll pause. That's kind of my top three overview at a super high level. Any questions on that, or things that aren't on that list that you're curious about that I can speak to before we dive in?
I do have a question, not
Yeah.
on that list, Grace Larkins, for the record. I've been wondering how the Medicaid Express is coming along.
Yeah, absolutely. So for folks that may not know, Medicaid Express is a project that we're doing to help build in our Medicaid enrollment process to our online health website, our Nevada Health Link. So that becomes kind of a one-stop shop for people to figure out and shop for health coverage if they don't have coverage through Medicare or through their employer. So we're on track to launch that at open enrollment this fall. So there'll be a lot more info to come. But basically what that means is for current Medicaid members, nothing's changing. But for people that are new or that are shopping for coverage that may be uninsured or recently switched jobs and don't have insurance, they can go to this website. And in addition to the exchange plans that you can purchase and you have to pay for, there's going to be Medicaid options available if your income meets that level. So our hope is that really helps people get access to Medicaid more easily, more quickly. And also we recognize everyone wants to do stuff online as opposed to being in person or on the phone for 9 hours. So we're really grateful for a chance to make that a little bit more modern and a little bit quicker of a process. So all is going well on that end. It's a ton of work. I really kind of group that into that first bucket of our priorities because what we're building for the eligibility changes for Medicaid impacts all the Medicaid Express stuff. So same team working on those, and that's a huge focus for us moving forward. Yeah.
Thank you.
Yeah, absolutely. Good question. Anything else?
Any questions from those online?
Okay,
Okay, thank you. Ann.
great.
So you covered this, definitely covered this a bit in your administrator's report, but the next item up on our agenda is the federal legislative updates.
Absolutely. So, Chloe, if you wouldn't mind sharing your screen, and if you want to start by introducing yourself, Chloe and I will be tag teaming this section. So really excited for you to meet her as well. So you want to start with your introductions and slides, then we'll go ahead and dive in.
Absolutely. Hi, everyone. Thank you so much for having us today. Oops, give me 1 second. My name is Chloe Chisim. I am the Public Information Officer for the Nevada Health Authority here in the Director's Office, and I'm very excited to be here with all of you this morning and to really dive into this plan and these updates that we have for you. So let me just get my screen shared and I will hand it back over to Ann. Can you all see my screen?
Yes, we can. Thanks, Chloe.
Okay, you're welcome.
So if you move to the next slide, I'll kind of talk you through what our focus will be. First, I'm going to start with just a quick review of what's changing. What are the rules? What's different? And what are we focused on? Then Chloe will give a quick overview of what's our member outreach and community education strategy to help people know about these changes. And then we'll hopefully spend some good time on discussion. We need your help reviewing, first and foremost, the notices. So this is what's going to get mailed, emailed, and texted to all people for whom these changes apply to in September. And we aren't going to move forward with sending those to be published until we get your input on it. And that's what today is for. So that's where most of our time is going to be spent. And then welcome any more general feedback on the approach, because we really, this is one of the most crucial times that we have to really communicate with Medicaid patients and our community at large. And so want to make sure we're doing it right and aligned with what your guys' perspective is on the system. So excited to dive in there. So if you move to the next slide, I think one of the most important things, I'm going to go through kind of the who, what, when, where, how. So let's start with the who. Importantly, not everyone who receives health coverage through Medicaid is impacted by these changes. So we have about 760,000 people covered in our Medicaid program right now. About a third of them are adults that fall into what we call our expansion population. So primarily these are adults that are eligible for Medicaid because they have slightly higher incomes than previously Medicaid would, or they have children or have other kind of income factors that make them fall into this group. So about a third of people are in the expansion population. That's who these changes apply to. But not all 273,000 will actually need to meet work requirements specifically, because there's a lot of exemptions or exclusions for who this applies to. So that's kind of the next layer of the funnel. And then the last piece that we're trying to make as small as possible is who's required to actually submit information to maintain their health insurance coverage. So we'll talk a little bit more about that, but our goal here is to use all the data we have available to us to automatically exempt or approve people to limit the amount of information and paperwork that goes back and forth. Importantly, of that 273,000 people, over almost 70%, so majority, are already working. So we think most people are working. It's just more a matter of submitting that documentation and ensuring that the hours they're working align with the requirements in federal law. So if you move to the next slide, Oh yeah, Azraella, go ahead.
Hi, Azraella for the record. So you mentioned to be announced or determined. Can you give us a little bit more details on what that looks like when we're looking at the population?
For the number of people who have to submit documentation? Yeah, great question. I'll talk about that actually, I think in the next slide.
Okay,
That
good.
piece is, we're not going to be able to project an exact number until we start running the data in real time, right? People could get a job in 6 months and it would count. So it's hard for us to get an exact count, but know that our goal is to narrow that to be as small as possible, but it will be a number of people that will have to submit.
So this is directed towards adults.
Correct, adults. Yeah,
Okay.
so good segue to the next slide here. So again, adults ages 19 to 64, but it does not apply to children, seniors, people that are pregnant, people with disabilities, people on Medicare, and people that have young children. So children ages 13 or younger. So if any of those exemption categories apply to you, you're automatically excluded and nothing's going to change, right? It's the people that maybe have older teens or people that do not have children at all that will be part of this population for whom these changes happen. We are expecting it to be about 150,000 people, but again, that number varies by the minute. So again, the goal is really to try to understand at a high level what these numbers look like. Does that make sense in terms of the who's affected and who's exempt? Is that helpful? We can come back to it if you have questions too. So yeah, go ahead, Azraella.
Yeah, it makes sense. Sorry, I didn't mean to raise my hand.
No worries. No worries. I do that often. Okay, let's move to the next slide here. Let's talk about the what. We talked about the who, this is the what. There's 3 changes that are happening to Medicaid coverage for people in that population. The first is that people will have to work or volunteer or do some other qualifying activity for at least 80 hours a month to maintain their coverage. So there's essentially a new requirement in place to be able to keep or maintain coverage. The second change is that currently everyone renews their health coverage through Medicaid every 12 months, so once a year. For that same adult population, that's actually going to happen every 6 months now. So it's double as often as it was before. And during those renewals is when those work requirements come into place, right? So we'll talk about some timeline examples shortly, but those 2 things will kind of align together. The third piece that I think is kind of in its own bucket is related to cost sharing. So as folks know, Medicaid is free right now for pretty much all recipients. No one has co-pays. You don't have to pay money to your doctor when you go in for a visit. There are some small number of people that pay premiums to participate in our specialized programs like our Katie Beckett program and Nevada Checkup, but pretty much all members, Medicaid is entirely free and intended to be a no-cost coverage program. That piece is changing as part of the federal law starting October of 2028. So just over 2.5 years from now, there will be co-pays for some services for some doctors that the doctors will have to collect when you come in for an appointment. You may be asking, Ann, that's a lot of sums, right? Like, what do you actually mean? And the answer is, we don't know. It's going to depend on what that guidance looks like. The next 378-page letter that we'll get from CMS will be about this one to tell us how we're going to do this piece. So we're kind of setting that aside from the purposes of our work right now because we have some time, but I do want folks to know that that's coming because that's another component of those changes. Questions on the what here?
I have a question.
Yeah.
Kehlani Queen for the record. So I did look at this before our meeting, and I think I'm a little bit confused with the 80 hours a month because it is really hard to find full-time work out here in Nevada. Somebody who's been working since I was 16 years old, it's really difficult to find full-time positions. A lot of companies will hire part-time or on-call, especially the large casinos and corporations. So how can we make sure people are able to find a position that would allow the 80 hours of work? And for the volunteer portion, with the increasing gas prices, if they're volunteering for 40 hours a week, it can be really difficult for them to get to those volunteer positions as well.
Yeah, no, I really appreciate that. And that is definitely our concern too, is we need to find ways to find what are called qualifying activities that really work for people's life situations. And that's going to look different for each person. So that's a great segue actually to the next slide. Let me talk about what will count. And so you can kind of see what that menu of options are. And then I'll talk about what we're trying to do to help people through that. So there's 6 different types of activities that really will count. At a high level, you have to either earn $580 per month or complete 80 hours per month. So that's, between 15 and 20 hours a week. So about part-time of any of these 6 activities or a combination. You can mix and match. So employment, that's pretty straightforward. We recognize in Nevada, our employment landscape, to your point, is really different, right? There's a lot more shift work, there's more seasonal work. And so we're doing everything possible to understand from CMS, our federal partners, how we can really calculate what that looks like. So how we're going to do this in Nevada, we have some options. And Chloe, keep me honest, I don't think we have a slide about the policy choices coming up, so I should just verbally talk about that. Does that sound right?
Yes.
Yeah, let me just verbally go through it because there's so many, we have a couple of different versions of this and it's easier if I just talk through it. So basically, when you enroll, if you're a new enrollee in Medicaid, so if I go to enroll in Medicaid in February of this year, I have to have completed, thank you, these requirements, a combination of these or earned $580 a month for 1 month in the past 3 months. So between November, December, and January, I must have met that requirement in one of those months. If I'm renewing my coverage in February, it's 1 month in the past 6 months. So it's not necessarily every single one of the 6 months, but any one of those 6 months counts, right? This gets complicated, so I'm not saying it's not complicated, but our intention is to try to be as flexible as possible to acknowledge for folks that may be doing seasonal work, we can average out what their earnings are. So if they get paid once in 6 months, it would still count towards this overall total. So that's kind of the employment category. Job training, so apprenticeships or trade programs count. School also counts, as well as that community service component. So there's different routes to get there, but we recognize that doesn't make it easier, even if there's more options. So what we're trying to do is in every notice and material we send out, connect to our website where we'll have a central list of resources like Employee Nevada, which is a free job finding service and program through the Department of Employment and Training. We're also going to connect with programs like United Way and other kind of larger volunteer organizations that can help connect people. What I've heard, we've been out in our rural counties a lot the past couple months. Some counties are developing their own websites for people just to get connected with volunteer opportunities. I do recognize that is a lot of time. And to your point, it's hard, it's expensive to get there, especially if it's unpaid. So trying to find ways to connect people, first and foremost with work that aligns with what they want to do in their life kind of situation. And then, of course, volunteering or school, if that's another option they would pick. So is that helpful? I know I recognize I'm seeing what you're seeing too. It's not going to be an easy process for some people, but we're doing as much as we can and welcome feedback if there's other things that you can think of too.
Yes, that was really helpful. I do have one more question.
Yeah.
For the record. Will there be any incentives to these large corporations from Medicaid to possible casinos to hire Medicaid recipients and hopefully keep them employed for at least a year or longer?
Yeah, it's a really interesting question. Because of federal law, as a state, we couldn't do those incentives, but I imagine there may be some more partnerships that happen with even some of our managed care organizations or like the United Ways of the world or others that are kind of connecting with folks, even just to get a hold of resources, right? We know that a lot of folks are struggling to hire right now too. So it's like, how do we bring the people together to help connect and help fill those roles? So I love the creativity there, and that's something I'll kind of keep an ear out for to see if there's opportunity for that too. Yeah, great questions. Yeah, no.
Bill Sims for record. I'm curious. So in regards to the volunteering and everything, like I know people will have to volunteer so many hours a week, but have you guys been told how people are supposed to track that
Great question.
to make sure that they have official proof to say, yes, I've been volunteering, like, you guys want me to.
Yeah, it's a great question. That's a lot of what those 387 pages are about is what will count. And so for 2027, for next year, we will be able to accept someone completing a form that checks a box and says, yes, I completed my volunteering for this many hours a week. And I kind of sign my name under the federal law or federal term is under the penalty of perjury, which is kind of scary, but basically just says,
Yeah.
I'm being honest, right? And if you come audit, I'll have a way to show you that I did that.
Okay.
Starting in 2028, we're going to need a lot more documentation. So probably like an hourly log tracker with from the organization you're volunteering with or something like that. But they're kind of giving us a little bit of a ramp up because that's a lot to ask for right away and to start out with. So yeah, but it's going to look different for every volunteer organization too. And we're not trying to put too much burden on them because we also want them to have volunteers and not add too much more work there too. So always a balance, but great question.
Okay.
Yeah.
Azraella, we see that you have your hand up.
Yeah.
Yes, hi, Azraella for the record. Temporary assistance for needy families, also known as TANF, benefits do not equate to the cost of living. How does Nevada Medicaid intend to allocate additional resources to meet work/volunteer requirements?
Yeah.
Thanks,
Azraella. So yeah. Oh, sorry, go ahead.
I know that in Ohio, when this type of work requirement and / community service was required for to receive health benefits, they had community service requirements, and they actually used to have work like gas cards and to get you to the location to search for jobs, and also to the community resources such as volunteering at a soup kitchen or whatnot. However, after a lot of budget cuts, they took away the gas cards, but given the climate of how expensive gas was, how expensive gas is Nevada Medicaid intending to give their recipients any type of assistance in that way?
Yeah, thanks for that question. And it's really helpful to hear the example about Ohio. I don't know how clear I was at the start, but that really reminds me, almost every single state in the US is doing this exact process right now for the same timeline. So we're all trying to learn from each other. And so those examples are really helpful to be like, oh, they have a good idea of how to do this. How can we learn from it? So legally, we cannot provide gift cards or any other incentive directly to our patients because of federal law. But our managed care organizations, as you all know, have the value-added benefits that they came and presented about, I think, at 2 meetings ago, where they can provide support through those types of initiatives. So I imagine that's already on their list, but let me add that. Chloe and I are meeting with our health plan leadership on Thursday to talk about how they're supporting our communications campaign. And that's a great example of thinking about how do they connect their value-added services, the kind of pursuit of these qualifying activities and help make that more affordable and reasonable for people. And definitely appreciate with the gas prices, that's a huge concern. So great idea, and we'll take that back.
Yeah, just TANF alone does not allocate enough of the benefits, especially if you're trying to pay for rent in this climate. So I was just putting insight on additional ideas. So thanks for that.
Yeah. No, thank you.
Yeah, question, Grace Larkins, for the record. On that same note, there is so much activity and job potential and interviewing that happens, virtually.
Mm-hmm.
So that might be another area. I can see how transportation aid would be helpful in that area, but also with technology, assistance in helping folks to get access to the internet and
yeah, absolutely. And I'll add that to the list to think through if there's any value-added services that may connect there, because that's a great call. One thing I'll note on that front, though, that we're also doing is we have a program called Navigators that traditionally has been through our exchange that helps people kind of navigate health insurance. We got a grant of over $1 million from the legislature last year to increase money to that program and have those navigators help people through both Medicaid and the exchange. So we're going to have people, we had 36 different organizations and providers apply for that funding to essentially hire a full-time staff person That would be someone who's embedded in our health centers or at the universities or at a food pantry or in other kind of locations where people already are, to help sit down with them and walk through the process live. So that way they don't have to rely on resources if they don't have them at home, for example. So that will be supplementing, of course, our district office staff who will help answer questions and really connect people to our eligibility staff. That will really work people through that process. So we'll have a lot of people that can support, and we're trying to do that through as many different means as possible and get creative with saying, we can't just expect people to come to our locations or to our website, but we need to also go out and really meet people where they are and be as helpful as we can in that. So definitely our approach through all of this.
Right. And on that note, as far as eligibility, so I know that for the waivers that HCBS waivers and such, those are still going to be handled through DSS eligibility, the financial piece.
Correct.
And was all of Medicaid previously through DSS for eligibility?
Yes.
And that is now moved over.
Portions of it will be on the health link, and then the remaining folks that are part of our waiver population or seniors or where there's more complicated rules around how that works, that will still kind of be the current process with DSS. But we're going through a lot of modernization efforts to make that system and technology and process continue to be better. And we're hopeful that moving out a lot of folks to the online process will give people more time to really support those more complicated cases too. Yeah. I think to your question, it's a good one.
Thank you.
Okay. Cool. We'll keep cruising. So Chloe, if you move to the next slide, Bill, this gets to your question about the how. So self-identification and exemptions are the big piece about those 387 pages that are all over the news these days. It's really about that. What's allowed? What are you allowed to kind of sign a form and say, I attest to this, versus what do you have to provide documentation? Because we recognize those are two very different things for people to move through. Fundamentally, next year, we're going to be able to allow attestation. The year after, it's going to have to be documentation first before you can attest. So we'll have a screening tool that folks can use when they're going through the process, but know that we're trying to use as much data from our existing vendors. So health claims data, wage data from Dieter, education data, all those components to try to make sure that we can kind of automatically check the box for people and they don't have to do anything before we request more information. So we can move to the next slide here. I'm trying to remember. Oh, the last one, the exemptions piece. We already talked about this mainly. This is another big piece of the rule that we just found out. So we already talked about people who are automatically exempt because of who they are. So kids, foster youth, parents of young kids, seniors, people that are pregnant, our tribal members are exempt, veterans with total disability, and people who are on Medicare. There's two other kind of categories of exemptions that we have. One is based on your health needs. The way the federal government is defining this is if you have a serious health condition, that means that you are unable to work, or there's a significant challenge to you working, that would exempt you from this requirement. In the past, it was thought that perhaps it was just having a diagnosis of a serious condition, but the way that they came out with the rule this week is it has to tie to you have the condition and it means that you can't work. That would exempt you in that top right category. The bottom right is about your situation. So people that are recently released from incarceration are exempt, people that are caregivers of people with disabilities, and people that are already meeting TANF or SNAP work requirements. So similar process is already in place for TANF and SNAP benefits. If you're already compliant there, we're not going to make you do it again on the Medicaid side, thankfully. And so we're able to kind of accept that and exempt people from the process. Nevada also intends to add a fourth category that is optional to allow people to be exempt based on short-term hardships. So that would include natural disaster, if you're hospitalized, if you have to travel farther for care, or if you live in a county with high unemployment. So there's 2 counties in Nevada that we think will probably meet that requirement. And so everyone who lives in that county would be automatically exempt because of a challenge to seek employment there. So that's the exemptions piece. But we recognize all of that detail. It's really complicated and it takes a long time to go through. And so we want to make sure we're communicating well. So before we talk about the cons, do you have any questions on that?
Yeah, I do. Bill Sims for the record. So on the disability portion, is there going to be like an exact detailed portion that says what would qualify for that? Because like me, for example, even though I do have cerebral palsy, the government does consider me able-bodied on some things.
Mhm.
So
Yeah.
how is that, like, is there gonna be detail that says this specifically, like, if you're disabled, but you are able to work, if we consider you to work, how is that gonna, how will that?
Yeah, you're asking the right question. That's why this is so complicated. So what we got from our federal partners this week is, I would say, a pretty general definition that allows states to pick what disabilities and conditions would be part of that. What is new is that we have to tie it to an inability to work because of the condition. So a doctor would have to essentially say, because of your disability, you're unable to work to the level that's expected here, and so you're exempt. So it's more of like a case by case review by a doctor, honestly. There will be some conditions on that list that automatically would exempt people. We don't need a doctor to sign off on the severity. An example that was used before was like really complex schizophrenia, for example. That would probably automatically exempt someone. Someone who has a wrist sprain, that may actually mean they can't work because of what their job is, but it doesn't mean that everyone with a wrist sprain can't work. And so we need a little bit more documentation. Is that helpful?
Yeah.
It's so complicated. Yeah.
Yeah, and one, that's the only reason why I asked, is just because so many people do consider me able-bodied.
Yep.
Even though I do have cerebral palsy, so
Yeah.
it just makes, that's why I just worry about it, because it's like, what if Nevada says, oh, hey, Bill, you actually can work, even though you do have a permanent physical disability, you gotta go to work.
Yeah.
So-
I hear you. I hear you. Yeah. Know that we're going to be as broad as we're able to within federal law, to be able to help connect people, to be able to exempt people. And then for, if it was a situation in which someone did have to work, we're glad that there's at least other options for what that could look like, including even some like online volunteer options or things like that. So trying to get as creative as we can to find something that would actually work for what people have an ability to do as well.
Okay.
Yeah. Thanks for the question. Yeah.
Question, Kelani Queen, for the record, for the complex or serious medical needs, could that also qualify as somebody with a recent cancer diagnosis who's going through chemotherapy and treatment?
Exactly right. Yep. So that diagnosis is on our list of definitions right now. I think we need to review based on the new guidance, whether we would need any additional documentation. I think it's pretty clear often if you're going through chemo that you'd be unable to work. So that should be an automatic exemption there, but we're still working through that process, but definitely on the list. Yeah. Thanks for asking.
I've got a question, Grace Larkins, for the record. Thank you, Bill, for bringing this up. It's something that comes to mind when we look at this in practice. There are not everybody has a primary care physician. We have a real lag, right? Of medical providers in general, which is being addressed in other ways. And that does make me wonder about, timelines. If somebody is trying to, they're requiring a physician to write out and submit this exemption, but can't maybe get into somebody, or there's a waiting list to find the right kind of person or even specialist that would be able to verify that, right? Maybe they would need a neurologist and they can't, get, so I'm just kind of wondering if we might want to look at that ahead of time, how that might be encountered when we get to it.
Yeah, absolutely. No, that's something that I've been really, it's been keeping me up since we found out that these rules have kind of shifted a little bit. Because you're right, we don't have the capacity that we need to on the primary care front. One idea we've been thinking about is, are there ways to connect people with virtual care, right? To see a physician that way. The challenge is a lot of times these people aren't insured yet, right? Like you don't have a doctor's note because you don't have insurance, right? And so we're trying to find the right ways forward there. I think that's where the self-attestation piece will be really helpful for 2027. So for the first year, if you're in a situation where you haven't had health coverage, you may not have a formal diagnosis, but you have a condition that would exempt you, you could testify that on the form. And then when your health coverage renews in 6 months, the hope is that there would already be a claim in the system, you've received, now that you have health coverage, you'll receive care that would have a diagnosis of that condition, and we could automatically approve you or exempt you at that point, and we wouldn't have to require more documentation. Does that make sense?
Yeah, you're right that if maybe in that first year, I understand what you're saying, but then after that, that's going to be really a mountain to look at if somebody doesn't have insurance and can't get access. It almost seems like if that's the case, there should be some, some medical professionals internally that can be accessed virtually to help move those along. Or maybe, maybe at that point it would have to be, a visit would have to be covered in some way. We can't expect somebody to say, okay, I'll just pay $600 out of pocket to go try to,
Right. Exactly. Yeah, I hear you. And I think a lot of states are really trying to think through what that will look like come 2028. So that's a question that we will need to really keep top of mind for ourselves and not just rest on 2027. Like we need to start planning now. So we're thinking about that on our end. And if you have ideas, I think the ones you listed are spot on. We don't have, from a state perspective, we don't really have medical professionals within our agency that provide clinical care, but I think there's an open question of whether the state could help fund some of that or what that could look like. So we'll keep thinking on it. And I appreciate you raising, because that's the right question. And definitely it poses a challenge.
Yeah. And just one more question. Looking through all of this, I can see that y'all have just a major administrative burden, right? That I can't imagine how anybody could keep up with it, any state. So are you feeling comfortable budget wise that there's staffing that can help through all of the changes?
At this point we are. I think it's because we had this kind of serendipitous modernization effort planned at the same time where we're moving stuff to that online platform. So that's going to be really helpful to free up time for the staff that do need to work through things with people directly. They have more time to do it. I think no state is under the expectation that this won't be a lot of work, and it's definitely, we're going to continue to monitor it, but at this time we're feeling like we have the staffing that we need to be able to support, and our intention is to really use our communications campaign to hopefully answer as many questions and be really proactive and help people know the rules of the road, so that way that process is a little bit smoother when they get to their own renewal too. But definitely something we're keeping a close eye on for sure.
Thank you.
Yeah.
I do have a question, Kilani Queen, for the record, or I guess a suggestion. Thank you, Grace, for bringing that up, because I've been navigating my own health issues and trying to find primary care and have been pushed back like 6 months trying to get in for an appointment. So that has been really difficult. I see that that's what is going on, at least here in Vegas, because we have a shortage of primary care physicians. So the idea I have for 2028 would be maybe requiring Medicaid recipients every 3 months to do a virtual visit with a primary care physician, and every 6 months, maybe an in-person. So they're able to bring up any health issues that they're having. The virtual visit, they can be sent in for blood work if required. And then the 6 month could be kind of a full physical, just to see how they're doing, to try to navigate better those difficulties and delays in getting proper diagnosis.
Yeah, that's a great suggestion. And I'm sorry to hear about how challenging it's been. I felt the same way when I moved to Nevada. I was like, oh my gosh, it's 8 months. That's a long time. So it's really frustrating, and it shouldn't be how our system is right now. So I'm sorry to hear that. As always, call your MCO, call the person that provides your coverage, and let's see what we can do to find other options that may be quicker. But I think the reality is we do need to get creative, and those kind of virtual models may be a really good way to do that. So I'll add that to my list, especially to chat about with our managed care organizations. They often have really good partnerships with virtual organizations that we could learn from there. So we'll think through what that can look like. I think regardless of this population, that would be helpful for all of us. So
yeah, I think that could be a great way to just take preventative measures before something gets a little bit worse, rather than waiting 8 months for a diagnosis and you could receive help,
Absolutely. We're going upstream wherever we can. Yeah. Thanks for that. That's a great suggestion. Okay. Azraella, thanks for your patience. I saw your hand up.
Hi there, Azraella for the record. Helping patients get help who need help. Thank you for providing a safe space for us to discuss this. From what I've gathered, in summary, you explained what short-term hardship exemptions were, which is uninsured and having a condition. And the hope is that after 6 months, there's a claim filed. Is that correct? To show that there is need.
Yeah, so
For
that would be
help?
for that top right, the your health needs one. So basically saying if you're coming to Nevada, maybe you moved to Nevada from California and we don't have any claims history in Nevada of you seeing a doctor here to say that you have cancer. When you enroll in Medicaid, you can say, hey, I have a cancer diagnosis, I'm unable to work because of that. We can accept that when you first enroll. And then within 6 months, the hope would be that you will be receiving cancer care in Nevada. We have claims for that and can note that you're automatically exempt through that process. Does that help?
In the application for Medicaid and the MCOs that you mentioned, is there an open text box on the online version where they can insert their health needs?
Yeah, that's what we're actually working on right now based on that federal guidance. It's going to be a screening tool, kind of like a survey. So less open text and more like a selection with a couple maybe free response answers as well. So we're trying to figure out the right way to do that based on the new federal law. And so we'll have a draft of that to bring to some of our public workshops to get feedback. But yes, it'll be kind of a supplementary part of the Medicaid application.
I have 3 questions.
Yeah.
How can we reduce the stigmatization of a serious mental health condition? Like what is considered serious? And
Yeah, no, it's a good question. So the way it's listed there is based on the way it's defined in federal law, but I appreciate there is a lot of stigma around the language. And so that's actually what we're trying to think through in our next communication section of how do we talk about this in a way that, to your point, isn't stigmatizing, but also helps people identify that if they may be exempt, right? So I honestly don't have serious mental health condition is maybe the term that we're most frequently using as opposed to severe mental illness or kind of some other terms that I think have more stigma. But if you have ideas of other ways to describe it, I'm all ears because we recognize there's definite need to destigmatize our mental health conditions more generally.
when we're addressing our needs, our health needs in the application, maybe having check marks or a checklist of various serious mental health conditions that might have the patients might be exempt for.
Yes, absolutely. Giving actual examples there, you're saying, rather than the broader term. Yeah, that's a good point.
And also leaving it open because the patient might not know they have diagnosed either, but they need help. Yeah, absolutely. Self-diagnosing, I don't think the providers really like that very much when patients go in there with Google, Dr. Google and saying, I have this, fix me.
Yeah. No, I appreciate it. And I think our goal is to help anyone who has any of these conditions get connected with the healthcare that they need. So definitely appreciate that.
And then my final question.
That's right. Oh, sorry. I just wanted to point out that we do also, later in the agenda, we have a roundtable discussion portion where we'll be able to kind of bring up some other things as well, if we need to.
Great.
And then my final question is, what are the verifications for substance use disorders?
Yeah, good question. It'll be primarily based on medical claims that someone is going through treatment for substance use disorder, so medication-assisted therapy or other forms of treatment. Or it could be something like an emergency room visit where someone has a diagnosis of substance use disorder there, or an inpatient hospitalization. So kind of a combination of whether you're accessing treatment services or have a diagnosis that's noted in some other claim.
And to follow up with that, if I kind of see substance use disorder being related to having a serious mental health condition potentially, when applying for Medicaid and the MCOs, can that be an option of underneath the conditions, saying possibly I have a substance use disorder, it's being untreated, but this is my need?
Yes, that would be part of the screening form for sure. Mm-hmm.
Thank you.
Yeah, great questions. Yeah, Bill?
I just have one question. Bill, stand for record. So this may be very unique, but in regards to disabled people being exempt,
Mhm.
what if it's a situation like me of someone being on SSI or SSDI and they want to go get a job?
Mhm.
How is that going? Could that potentially impact them?
That's totally fair game. The only thing that could impact is if the job that you have makes above the income threshold that would make you eligible for Medicaid.
Oh, so like
Yeah.
regular rules?
Exactly, regular rules. Yeah, there's
Oh,
nothing,
okay.
but nothing about this would change that process.
Oh, okay, okay.
Yeah, good question. Good question. Okay. All right. So thanks for all the good questions on the policy front. As you can appreciate, it is so complicated. You guys are totally understanding it well, and I want your brains reading that 387 pages because that's helpful. You're asking really helpful questions. So now we're going to move to how do we talk about this and how do we communicate with our members, our current members and our broader community of folks that are helping people navigate our healthcare system on what's changing and why. So Chloe, I'm going to turn over to you to talk about our strategy and timeline here, and then this will be really our discussion section.
Thanks, Anne. And yes, just to reiterate, really appreciate all of the thoughtful questions and feedback. I hope we can continue that into this next part of our presentation. So Chloe Chisim, for the record, I'm the PIO at the Nevada Health Authority, and I am really working with our Anne and our strong team at the Health Authority to lead this effort to communicate these changes and what is happening to our members and their communities. So as I mentioned, we really hope this can continue to be a collaborative discussion. We are really here because we want to know what you think, your feedback on not only our strategy, but the messaging and methods that we're using to get the word out to our members. So we'll just start off with a broad overview of our communication, outreach, and education strategy. So our overall goal, we really want to ensure that this information about the new federal rules and requirements reaches our members clearly and effectively. And that can mean a lot of different things. Main goal, top of mind to me, would be helping folks understand what is changing and what they need to do to retain coverage. We know it's complicated. There's a lot of moving parts. Bottom line for our members is, how is this going to change my life? What do I need to do to play a more active role in my coverage and maintain what we currently have? So we really want to focus on a clear and consistent messaging platform that reassures our members. A huge part of this strategy is partnering with our community organizations, navigators, trusted messengers to help us communicate this message in a way that really meets our members and their communities, utilizing all of the tools and partners we have to make sure that this message reaches as far as it can. A more technical part of this strategy that I'll get into later is we're going to be creating and distributing messaging guides, talking points, toolkits, resources, and continuing education to those partners that we'll be working with and our stakeholders so that they can confidently pass along this information as they see members, whether it's at their doctor's offices or in their lobbies, wherever folks may be. We want to make sure that that information is available and that the folks who are talking about it are knowledgeable and can help answer questions wherever you may be. And bottom line, we really want to emphasize that we're here to support any resources that are at your disposal and pathways to maintaining your coverage for our members, really using plain, straightforward language, avoiding using confusing industry jargon. We know that it's already confusing, a lot is changing, so our goal is to just make it digestible and easy to understand. Continuing on with our strategy, we are really viewing this in two separate buckets, just to break it down a little bit. And I will dive into the details in each of these buckets more as we move through the presentation. But the first bucket we really see is our targeted member outreach. And these are notices and specific pieces of communication that will go to our members in this population that will be impacted by new rules and requirements. So that will come in the form of mail, mass mailers, emails, texts, using as many forms of communication as we can, just to ensure maybe if folks don't have access to a cell phone or computer, that they can receive these notices in the mail, making sure that those targeted notices reach the people that they need to go to. As we move through implementation and we may need more information, folks will be getting renewal packets, requests for information if we need more to verify compliance, notices of maybe non-compliance, and providing the opportunity to regain or get back into compliance to retain coverage for new members, approval and denial letters. And then following January 1st of 2027, we really want to focus on continuing outreach after these new rules take effect. We are going to learn a lot between now and then, and really want to target our communication based on what we learn between now and then. And our job doesn't end on January 1st of next year. We are here to continue helping our members through all of these changes. And moving over to our community education piece, we view this as proactive, really additional communication and education activities that we can do to help spread the word. So we've already hosted one public workshop, I believe back in March. There will be at least 2 or 3 more, really focusing on what we're learning as this process goes on. Hopefully hosting some focus groups and listening sessions so that we can hear firsthand questions and concerns. I'll dive into more to this later, but really focusing on stakeholder engagement, printed materials like fact sheets, brochures, resource guides, additional printed and digital materials that we can make available to our stakeholders, our partners, and our members. And we will start to utilize social media, advertising, marketing, a lot more proactive activity to get the word out as we move forward. Are there any questions here before I move on?
Those 2 buckets make sense. I just want to acknowledge Chloe explained it to me in this way, and it really clicked. It's like there's the direct, super individual, we need something from you, something's changing. And then there's the broader, hey, things are changing and here's how it impacts Nevada. So thank you, Chloe, for that framing.
Yeah, absolutely. Thanks, Ann. Okay.
Oh, Chloe, I think we have 2 hands up. We have 2 hands up here, so maybe we'll go back.
My screen sharing, I can't see raised hands. So however
totally
we want to that, yeah, great.
You're totally fine. I can call them out. So yeah, Azrael, I think you're first.
Hi there, Azraella for the record. I love what you've done here. The goal is to ensure information about requirements reaching via notices, and you described the notices. Ooh. Can you hear me? Sorry, was I muted?
Oh, I can. Yes, I can hear you. No.
Oh, okay, sorry. And you provided notices via mail, text, online, so that members and stakeholders can receive various tools of these notices. I just wanted to give you some input on non-compliance and provide an opportunity idea when members are not compliant, instead of saying you're not compliant and you have this date to submit some information. We could open that conversation up by providing an office visit date. By this date, you need to come into, like, I know it used to be called welfare, but you can come into the office and speak with a caseworker. And in that notice, you can have the set date to go into the office. Sometimes doing all this paperwork is pretty intimidating for members, and they just get behind because of life. And then, so having a set date to meet with a caseworker in those notices can be very helpful, because then it gives us a deadline to get that paperwork in.
I really appreciate. Oh, sorry.
Yeah.
Go right ahead, and I can respond once you're through. Thank you. I totally agree.
And then another concern I had is that public workshops are geared towards state-employed stakeholders and not recipients. How can we get our members involved in public workshops? Thank you for your answers.
Absolutely. I'll start with your public workshop question. We do our very best to open this up to the community, and I can't remember how many were at our last public workshop, but we do our very best to open that up to whoever is interested. Notices are sent out on our listservs. We post them on our websites. for really all to attend. But I completely understand that that can be a little less accessible. So an idea we've been throwing around is maybe town halls or community meetings that are held in person, which is something we're really going to utilize our navigators for and our community organizations to help us really drive that effort forward. Making sure that we, again, as I mentioned, are meeting our members in the communities. Maybe a virtual public workshop isn't accessible or isn't possible for someone. So an idea we've been thinking about is doing maybe one of these public workshops or community meetings or town halls in person. So I really appreciate that feedback, and it's definitely something that's on our minds. And over to the notice question feedback that you have about an office deadline date. I can't remember exactly what notice, and I think the names of each of these might be a little bit up for subject to change, exactly what each of these notices will be called. But I think notices of non-compliance you will have, I think, 30 days to, and it will outline all of these specific dates for you to either demonstrate that you are in compliance, or I believe if there's maybe a cancellation, to appeal it. But there will be those deadlines since these outreach notices are targeted to each member. They won't just be general, you need to do this. We will have that information and hopefully some hard dates that folks need to take action by. And Ann, correct me if I'm wrong, but I think that all of these in the targeted member outreach list are specific to your individual information and situation.
Yes, that's correct.
Yeah, great answers, Chloe. I would agree with all of that. And I like the idea of the framing, Azarella, on kind of come to our office by this date. I think that is a really helpful kind of action-oriented way to describe it. As Chloe and team have been working, we have to always thread this needle of there's a lot of language that we just legally have to require in there in a certain way, but there's other things we can add in addition. So when we get to the notice section itself, I think that would be a great thing for us to think about where to put it. But love the idea and agree, finding ways to make the public workshops more accessible and available, and finding other avenues that might be outside of regular business hours will be really key to meet folks. So thank you for that feedback. Yeah, I see Christina, your hand up next. Just because of the kind of laws that organize this section, this part of the discussion is only for our BAC formal members, but we'd love your feedback in our public comment period. And we'll also be talking about this at the MAC later this afternoon. So if you want to chime in at that point, would love to hear. So apologies we can't get to your comment right now, but look forward to hearing from you soon. Cool.
Do I have any additional questions?
Let's keep going. Thanks, Chloe.
Okay, perfect. All right, so moving forward, this is a high-level timeline of our communication strategy and really some key dates for our Nevada Medicaid members and their communities to know. So I'll start with really what's happening right here and right now. As you all know, we are working on the language for our notices, and that will be finalized this month. And we're also developing language for our legal immigrant population, the notices that will be sent to them. Those changes are taking effect later this year, as Ann mentioned. So that's being done right here and now. We're really excited for your feedback on the specific language that we've developed thus far. But by next month, those notices hopefully will be sent to our legal, that's the plan, to our legal immigrant population. We will be sending those notices out since those changes do take effect sooner than the work requirements. But before then, we are making sure that all of our notices are translated so that they're accessible to our members. So that's the deadline for next month, is having whatever language we do finalize with this group to be translated and accessible. Over the summer months of this year, as I mentioned, we'll be hosting another public workshop, hoping to make that one very communications focused, letting the community and members know what specific forms of communication and education and outreach and notices that they will be seeing, what they can expect for the second half of the year, and hopefully having a very open dialogue again, and allowing for questions and concerns. And we are also going to really initiate our broader external communication strategy, fully engaging our stakeholder groups, making sure that they have those materials accessible to them so that they can start spreading the word for us as well. So it's really going to boom this summer. And then later in the summer, in August, the plan now is to initiate our media, marketing, social media are more of our proactive communication activities in the media. Moving into the fall, as we mentioned, the September 1st is the deadline for those specific member outreach notices to be sent. So those will be in the mail by September 1st. The federal deadline for all members to receive these targeted communication, these targeted outreach notices is September 31st. So we will have those in the mail and make sure everyone has those one way or another by the end of September. Later in the fall, more public workshops, really incorporating what we've learned so far throughout the implementation process. And obviously it gets a lot more detailed, but these are just some of the high level communication dates that we want you all to be aware of leading up to January 1st of 2027, when these new requirements begin. The work and volunteer 80 hours or $580 a month, and the 6-month eligibility or renewal redeterminations. And then throughout 2027, as I mentioned as well, the continued outreach and education post implementation, all really based on what we've learned, what we do learn for the rest of 2026 as we work with our members and their communities to get the message out and to make sure the information is readily available. And then a really huge important bucket of our community education strategy is our stakeholder engagement. So we plan to utilize a very broad group of our stakeholders to help us meet our members where they are in their communities and really get the word out. So 4 important buckets in this category are our Medicaid district offices, which are in Las Vegas, Reno, Carson City, and Elko. Our health plans, Health Plan of Nevada, Silver Summit Health Plan, Molina Healthcare, CareSource, and Anthem. As Ann mentioned, our navigators, this is a really big bucket, to name a few: Dignity Health Community Health Centers, Asian Community Resource Center, Access to Healthcare Network, Nevada Health Centers, and more that will be decided after this grant funding. So this is a great group that we are super excited to work with. And finally, our community organizations. This really ties into additional resources for folks to be connected with employment and volunteer opportunities, helping people stay in compliance or get in compliance who need to meet these work requirements, which would include Nevada Department of Employment Training and Rehabilitation, or DETR, Employ NV, the Office of Workforce Innovation, United Way, and many more. So our outreach strategy really involves bringing in this broad group of stakeholders to not only help us, but also take initiative themselves as well. They know their communities better than anyone. So this is why we engage our stakeholders and communities, because it really does make it more effective to bring everyone into the same page and get the message out there where it's needed. Ann, do we want to take any additional questions here before we dive into the notice language?
We have one question here. Yeah.
I do have a question. Thank you. This is great. I can see, how much work has been put into this. When I'm looking at, the efforts, clearly because it is such a big change, and there's all the administrative aspects of this new work requirement population. But when I love your graphics, that was in an earlier slide, but we're looking at that total Medicaid population, as well as those that are, required to submit more information or may need to apply through a different route, such as the aging, disabled, that population. When I look at, for example, that was emailed out, kind of a first draft of what would be the physical mailer, this kind of thing. There it is. Great. Thank you. I love that there is some visual. Here's these different chunks of the population. You may fit into this, or this. I think it would be really, is there thoughts of having a section within this that if you are exempt because of this, here is how they're going to need to apply it a different way, not through Medicaid Express. This would be a great space to automatically answer a lot of those questions of, you will not be applying via Medicaid Express, you will need to apply here. And then I also wonder, when I look at the stakeholder engagement, I think it would be great to see a representative organization or organizations regarding that MABID population, because they're going to still be receiving the same handout and it's not going to feel relevant to them, right?
Yeah, so no, I appreciate that question and we definitely want to be really clear. So this notice only goes to this adult expansion population. So of current members. So it only goes to people who it may apply to. So anyone in that MABID population, anyone who is, a child, a senior, a person with disabilities, automatically, they won't even get anything because nothing's changing.
Okay.
So this is really intended to speak to the people for whom it does apply. But to your question, I think your question really is applicable, especially to the community education piece, which is to say, if you don't have Medicaid, if you need health insurance, where do you go, right?
Mm-hmm.
And so our intention is all of our messaging will say, go to the exchange or go to what currently applies. If you go to the exchange and you have a disability and you actually need to go through the other door, we'll automatically move all your information over and someone will give you a call. So there's no wrong door. Like people can go in any direction because we really want to make sure people get where they need to go and they get their coverage that they need. So at a high level, this notice, I think it's fair. Maybe we can think of ways to really clarify that who line. But it only does go to the people for whom it might apply. Anyone who falls into those categories wouldn't even be getting it in the first place. Oh, is that helpful?
Thank you for the clarification.
Yeah, no, it's a good question though. So I'm glad we can speak to that. Yeah. Let's go there, Chloe. Do you want to move to the next slide and we can kind of talk about the notices themselves? I think that's the segue we need. So thank you.
Yeah, absolutely. I know that the council has this. Do you want me to pull it up in Word so we can maybe zoom in, or is this sufficient for where we're at right now?
I think we have copies in the room for folks that are in person here. And then Azraella, do you have a copy on your end?
I do. I can find it on the email, I believe. Jonathan sent it to me.
Great. Okay, sounds good. So I think we're good, Chloe. I think fundamentally the goal, and maybe if you want to actually just move to the next slide here, these are the discussion questions we want to tee up. So on the notices themselves, what's working? What's not? What would you want us to tweak? Again, this is our draft. So this is not final by any means. And so we want to make sure it makes sense and is readable. So any and all edits, I have my pen ready to go. Chloe will be the same. Like we want it to be clear, informative, and not overwhelming, but also comprehensive. So thoughts on whether we're meeting that mark or what we can do to make that better.
Did you have a question, Kehlani Queen, for the record? I'm on the email notice. So on the very end, it says living in an area with a high unemployment rate.
Yeah.
So if I'm not mistaken, I think Nevada and California are like neck and neck with the unemployment in the entire country. So I think there needs to be a little bit more definition on what that means.
Yep, good call. And the way in that federal rule, we have to define it by county, and that county has to be approved by CMS as having met it. So I think what we can do, Chloe and team, is we can think about essentially, if you live in that county, you don't even have to tell us, right? We have the zip code and we'll automatically exempt you. So maybe we can even list those counties to say, if you live in Mineral County, I know for sure will be one. There's a question of whether there's going to be a second. We can maybe actually just list what those are so it can be clear to people what that means and whether they need any information. So I think what I'm hearing is two-part feedback. One, let's be specific about what the area means, right? And then number two is think about which exemptions we're automatically going to calculate versus which we need information from, and maybe bucket those in two ways. Does that make sense, Chloe?
Totally. I've got all that. I couldn't
feedback.
agree more. I also, kind of going back to a previous question that we had, but the focusing on the short-term hardship exemption, it is just that it's short-term. So I think huge piece of why we are doing this proactive communication and outreach and education strategy is to not only get the word out and communicate directly with the members who this may apply to, but in case your situation does change and something in your life happens that maybe all of a sudden you are in this expansion population, or now you have a certain health concern or health situation in your life, there are reporting requirements, and we want to make sure that if a life change happens that does put you into this category where you do have to meet work requirements, that you know, and you don't miss anything that would require you to keep your coverage. So temporary short-term hardships that I think can be subject to change, and correct me if I'm wrong. I know we're waiting for a few additional details and like the definition exactly of what that can mean. But also your life situation is dynamic, it fluctuates. So that's really the whole point of the communication and education strategy, is making sure that if something does change in your life, you know additionally what you need to do, even if it might not apply to you right now.
Oh, thanks, Chloe. I agree. And this is where it's complicated, where we're going to send these messages out in September, right? So people will get the emails in September. But say your Medicaid renewal date, say you enrolled in Medicaid in August of this year, right? You won't renew again until August 2027, meaning you'll find out in September that something's going to change, but it doesn't really matter. It doesn't impact you for a whole year. So I think that's the other piece that we can really think about, is how do we really describe what the renewal date is? We're not unfortunately going to be able to add it to every person's mailer specifically. So it's going to come down to, do you know when you enrolled in coverage? And if not, here's where you go to validate that. So that way people know when they're actually going to have to meet the requirements. Because it's not that everyone on January 1st has to meet it, right? It's that you have to meet it whenever you renew after January 1st. Yeah. Azraella?
Hi, Azraella for the record. And just to clarify, we're having a discussion about our opinion on whether the requirements resonate with upcoming changes. Is that right?
It's more about the way we describe the notice. Does the notice make sense to describe what the ask is for people at this point?
Sorry, you cut out there. Can
Oh,
you
shoot.
repeat that?
Sorry, yeah. The discussion is on the content of those notices. So the email notice and the physical mail notice, to get feedback on the language there. Yeah.
Hi, the Flores Socialist for the record. I think there's a question up here on, in your opinion, does work and community engagement requirements or work and volunteer requirements resonate more?
Oh,
Maybe is that
sorry. Thank you.
No?
Azraella, is that the
Yes.
question? Yeah. Oh, thank
Yes.
you. Yeah. Thanks, Nahivi. So yes, that's one of our questions, is how do we describe it, right? Like I said, there's like 6 different things that count. We can't list all 6. And so we're trying to play around with, do we call it work requirements? Do we call it work and community engagement? Do we call it work and volunteer? Like, are there certain ways to describe this that feel like it makes sense to you all?
So under the TB or to be determined for the, I guess what I'm asking is the work requirement exemption survey, is that going to go out after we send out these the materials?
Sorry, say more about what you mean by survey.
You had mentioned that some adults might have to have additional information to determine whether or not they're eligible.
Yes.
And it would be in the form of a survey. And I was wondering if that's going to be implied in the notice, or if that's going to be spoken about after the notice is sent out.
Good question. So the notice is basically to say, hey, things are changing. The next time you renew your Medicaid coverage, in that packet, there's going to be more information that we request from you if we need it. So yes, it'll be a follow-up where more information is requested, not in this one.
Thank you.
Yeah, good question.
So as far as, I'm sorry, Bill.
Oh, no, go
please.
Well, I was gonna say in regards to the work and community engagement, I think honestly, it should just say work and volunteer.
Okay.
Because because then people know exactly what that means, what they'll have to do. Because like, as someone who does several things for advocacy work, to me, community engagement doesn't necessarily just mean volunteering.
Yeah,
So
that's a good point.
I would just think work and volunteering because it's more straightforward.
Yeah, I like that feedback. My one question to you is that confusing for people that are going to use school as an example, as a qualifying activity, right? You know, this is where we're struggling, where it's like either we say work, school, volunteer, apprenticeship. Well, that's a little hard, right? Or we pick a fewer of them, right? Like what's the couple that makes sense? And maybe that's fine. Maybe work and volunteer is okay, and people that are in school would read that notice in more depth and realize what it is. I feel like in the news, it's mainly just work requirements, right?
Okay.
But we don't want people to think they can only work, right? So that's why we're struggling. That's why we're going through ideas. Yeah.
Then my follow-up is, since you guys are like wanting to mention all 6, is it because you're like, are you not allowed to, or is it just like basically to save space?
We are allowed to. It's more about saving space and thinking about the way to describe it clearly. Like if there's an ad that pops up on your Instagram, if it says 6 different things, does that feel clearer if it's just like one thing that's super clear, right?
Gotcha.
Yeah. Yeah, do you have thoughts on that?
Yes, Kehlani Queen, for the record, I agree with the work and volunteer. I think
Okay.
school can definitely fit in that work category as somebody who.
It is a lot of work. That's true. Yeah.
I think that could qualify as the work experience, and they can
Yep.
go in depth if they have any questions. They can always give a call or just read. And volunteer can help so that they're able to apply online for volunteer positions rather than looking for community engagement positions.
What does that actually mean? Great. That's really helpful feedback. And that's smart to think about school being in a work category. It is a lot of work. I think that's fair. So that makes good sense. Yeah. Great. And then Azraella, we can go to you next.
Yeah, I think just because I do have a graphic design degree, so I can't help but look at things in a really visual way.
Yes.
And I think there are, especially when we're looking at different kinds of learners and we're looking at different, as far as primary language use, what is someone's primary language? What I would love to see on this is like you're saying, that nice, broad, bold, short heading, work and volunteer requirements, right? Or something, and it's a really easy short phrase there.
Yeah.
But then also if, as you mentioned, like the timeline, as far as who this applies to, like what are the different populations and the exempt populations. So it would be great to really see those in just simple visual chunks, and really kind of looking at like what are the main things that we want to get across in this. And it seems like it is, who it applies, who, when, and so there's the who, and then there's the who not, who is exempt.
Yeah.
Right. And then I also am wondering if there's a plan to put a link for the, I love the new Navigator program that y'all are talking about. I think that's a huge resource, and I'm wondering if there's a plan to have that. If you're looking for more information, here is your local Navigator kind of a link on there. Is that?
Yeah. So personally, love the graphical design approach. That's exactly what we need. So thank you. I like that, Chloe. We can think about how do we put even almost like an actual visual image at the top of this. It's like a who, what, when visual, and think about how we do that and then add detail below. I think that makes good sense. And yes, we will. Our intention is there's so many resources we want to connect people to, and that gets confusing if there's a lot of websites. So our intention is to link to our HR1 page. And at that point, then folks can get connected to work resources, volunteer resources, navigators, all those pieces. So there's not going to be
including that directly on there.
I don't know that, unfortunately, the navigator process, I don't know that will be set up by the time this notice goes out, right? Yeah. So the grant funding is going to go out the door in July. And so I would hate to put folks in a position of not having a staff ready and they're getting calls. But I think we can say, if you have questions or need help through the process, go to this website. And then we kind of show like what those resources look like.
Yeah.
But in future mailings, when navigators are ready and we have that full direct contact, I mean, the challenge is there's going to be like 40 or 50 different organizations, right? So thinking about like, can we create a map? And it's like, go to this one if you live close, right? Like there's ways we can think about doing that I think would be good.
Yeah. Well, and when I mention graphics, really, it's almost like what I see on here with a lot of narrative. You've already done the work here on your slides. Yeah. If it could really just essentially, this is done really well with these large blocks and the 1 and the 2. And it's thinking of it on that level as if you're putting together as a slide, but at a 5th or 6th grade reading level kind of an approach. And it kind of feels like the work's already been done in a lot of different ways, even with the graphics that you're showing, the screening tool and the, it's a lot of it's already here.
Yeah, if I could just jump in real fast and totally agree and really appreciate the graphic design feedback. I think there's a way we can really incorporate the technical aspect of these notices with a digestible visual. I think that would definitely be really helpful and somewhere that we can work on. But I do think that the intent of these mailers is it is more technical. And as Ann mentioned, there is some federal language that we do have to include in these notices. So everywhere that you see website TBD or phone number TBD, in the email, there will be an active clickable link to our comprehensive HR1 dashboard on the Nevada Medicaid website that hopefully it's under construction right now, but we'll have dynamic graphics, all of these presentations and the PowerPoints and public work links to public workshop recordings that we've done, maybe ways to actively find out if you do fall into this category. But, as Ann mentioned, this notice is only going to come to your door or in your email if it does if you are in that population that these requirements apply to. So, this is really the targeted outreach. Here is exactly what you need to do. Here is exactly what will happen if these requirements are not met unless you are exempt, which is why we did try to go into detail of those exemptions on the second page of that notice. But there will be access to far more maybe visually pleasing and easily digestible information on our website and on those additional resources, as I meant earlier, message guides, resource toolkits, brochures, flyers, that will be maybe more of the broad visually digestible representation of all of this information that might not be targeted to who this notice is being sent to, but that is very helpful and educational. So we want to make sure that you folks have access to all of that. And I hope that adds some clarity as to why this is so technical, but we tried our very best to keep it at the 6th grade reading level while still communicating everything that is very important that members need to take action on.
Right. Thank you, Chloe. That makes a lot of sense. And I think that there's probably just a little bit of an in-between, right? So I can see exactly you've got a lot of information you have to get across on here. Mm-hmm. And it's really just a little bit of tweaking, I think, to make it digestible. It's just like you said.
Totally agree. Yeah, thank you.
Just a little minor note. For me, when I first read it, I felt confused on this very first paragraph on the physical mail. The members listed below will need to prove that you work, volunteer, or qualify. For whatever reason, when I first read that, I think even if it just said that the members listed below will need to prove that they work. Because I thought, at first I thought, oh, are we supposed to list somebody here that can prove that we are working? Right. So there's just a little word tweak on that one.
That's really helpful. Thank you.
And then just really quickly before we move on to Azrael, I just want to mention that these are great discussions, and I want to make sure we get to the rest of the agenda as well. So, we'll go ahead and take Azrael's question and then move forward. Yep. And then if anything, we can just address any more of these concerns or have more discussions during that roundtable discussion. Second to last agenda item.
Jonathan. Yeah, Azrael.
Thank you for taking my question. Azraella, for the record, I do like the title, Get Ready for Work, Education, and Volunteer Requirements to Keep Your Medicaid. I like that it says work, education, and volunteer, so it actually defines what's required. However, I think the differences is applicants versus member. So to keep your Medicaid, you're already considered a member. However, applicants don't have Medicaid to begin with, so they can't keep it. And then I believe Kai added that we should do a QR code in the mail, email, and text. And we can add that to next to email, mail, person access and service listed underneath. What if my situation changes? And I think that's all I just wanted to add.
Thanks, Azarella. Just so I'm seeing, are you seeing applicant listed somewhere? Because I definitely want to clear that up. That's a good point.
So I do not see applicant at all, other
Okay.
than what if I don't meet the requirements, but that's already if you're a member.
Yes. Okay. That's helpful. So yeah, these notices will all be to current members. So you're right. We can just use member. But for anything that we do for the broader community education, we'll definitely want to make sure it's clear that it applies to both applicants and members, new and returning. So that's a good point. Thank you.
Thank you.
Great. All right. So what I'm hearing too is work and volunteer requirements is the thumbs up, is the language we're going for there. This has been incredibly helpful, and I have a lot of notes to bring back. So we'll keep tweaking this, and we'll continue to make it strong. I'll also note we'll be back in future BACs to talk about all these materials. This is the one that goes out in September that we have to finalize, but there's going to be a lot more that we'll ask for your feedback on. So thank you as always for your help and support with that, because there's a lot to do and make sure that it is described clearly. So we appreciate it.
Thank you all so much.
Anything else you want to add in closing?
Just totally agree with Ann. This has been hugely enlightening and helpful. Your perspective is so valuable, and really looking forward to incorporating all these questions and feedback into what we send out. So just truly thank you. This was my first time being at a BAC meeting, so really appreciate you all having me today, and looking forward to working with all of you and hearing more from you as we move forward with this plan. Thank you.
Thanks, Chloe. We're glad to have you, and glad to have you coming back often.
Great. Thank you so much, Chloe. And I agree. It feels like a really rich, real thing that we have in front of us, that we're seeing how that impacts directly the community. So we really appreciate that. But I think for myself that I'm with the BAC. And I think now, if that was our federal legislative update, as well as this HR1 outreach, and we're going to move on to take a look at agenda item 9, the Medicaid satisfaction surveys.
Great. Well, thank you all. You'll have to listen to me for one more item, which I appreciate, Kai. And I will be jointly presenting this today, which I'm really grateful for. So Jonathan, are you able to pull up the slides for this, or should we have Kai do it? We're good either way.
I can pull them up.
Okay. Well done. Thank you. Well, Jonathan pulls up the slides. Kai, do you want to just give a quick intro?
Yeah. So we have Medicaid beneficiary surveys. I think that this came about after hearing that Washington State does something similar, and a couple of states do something similar. And it was kind of a personal issue for me. I would go out and see people in the community. My hairdresser, believe it or not, I have one, was really happy with Medicaid. And so when I would tell people that I work for Medicaid, then they tell me a great story. And I was wondering, how can we get these stories out there in the community? During COVID, we saw that Washington State was doing something like this, where they take members' stories and then they put them out there. And when we solicit stories, when we say, hey, tell us your story, we often get really great stories that are inspirational for our staff and for other members, and show the good work that we're doing. So we put together this survey, and we use it for a lot of different things. So if we want to move on to the next slide, I think did you want to talk about the summary here and the ask, Ann?
Yeah, I think Jonathan actually is gonna kick us off. So thanks, Kai.
Hi, everyone. Jonathan Figueroa for the record. So in our meeting back in March, I remember the council had brought up talking about or potentially developing member satisfaction surveys. But before we wanted to take on that task, we wanted to bring to the council what we already have, and to show you guys, what do they look like, where they can be done. Basically, just to quickly sum up why we're bringing this to you guys today. And then, with that being said, I'll just hand it back over to Kai. That way he can go over the surveys that we do have.
Yeah, I've got a a small screen up here and then a big screen. So I'm going to look at my big screen here as we go through the slides, and I'll flag when we want to move on to the next one. So does Medicaid have member surveys? That was a big question, right? Well, you can find them on a couple of locations. We'll talk about that in just a minute. So we've got an existing online survey, and it can be easily adjusted. So we've got one QR code, one link, and then we can adjust the questions in there according to our needs. And we do it for various reasons, but the link never changes and the QR code never changes. So that's a wonderful benefit that we have. And so the background on the member stories, I think I gave a little bit of that just a minute ago. And our goal here is really to foster two-way communications. We don't want to seem like we're just some agency and that is unreachable and not looking for feedback. We are looking for feedback. And so we want that two-way communication. We can identify partners, and these aren't just organizations. These are people out in the community who want to help us. So we can send them materials and say, hey, would you mind putting this up in your community center or telling your friends and family about it? And then Medicaid staff inspiration. So some of these stories, if you take a look at that powerful stories slide up there, there's a ton of stories just like this. Being a part of Medicaid has been life-changing for me. The quality of care I received from listed providers is amazing. The communication from the staff is to home is outstanding. Medicaid has been nothing but a blessing for me. And there's a lot of stories of children and parents who were really struggling until they received Medicaid. And so, these are inspirational to our staff and to people out in the community. As we move into social media, again, with the Nevada Health Authority, then we'll start to publish these again, hopefully. Now, we can cater our communications here, or use the survey to cater our communications. So at the results slide, or the results image that you see on the bottom right, there is a statewide managed care flyer that we put together. So the way that this flowed is we put together a survey and we said, what are your problems out in the rural areas? And tell us what they are. Would you like better access to appointments or faster appointments, things of that sort? And so then we took that information and that feedback from members, and we said, here's how statewide managed care is going to address these top needs that you have in your community, and then we can cater our communications to it. So members aren't wondering, well, why are we doing this statewide managed care? They can see it right there. This is to address our needs in our community. And then we can measure our success. So every time we send out a survey, and we do it through different modalities, and we can target specific zip codes now, then we see what our response rate is to that modality. So whether we're sending it over the app or through listserv, which is email, or social media, then and we do it during specific times so that we can see, hey, what's the best way to reach people, and how do people, who's more likely to respond. And we are looking at some expanding of methods to reach people. Next slide, please. So what does the survey look like? You're all wondering this. Well, you can go on to nevadamedicaid.nv.gov. You can find it there, and you can find it at medicaid.nv.gov in the upper left-hand corner. But here are the questions. How satisfied? So it's satisfaction survey, right? And I think we're somewhere close to a 4 right now. How can we do better? This is the question that we used to cater our statewide managed care communications. And then if you answered something else, well, what is it? So we give a lot of opportunities here, 3, 4, and 5, for people to really do long format answers. So they're forced into a star or forced into a multiple choice question. They can answer any way that they like, and then we have staff to read them. And we're not overwhelmed by responses here. It's reasonable amount of work to read through them, and then we do have an opportunity for people to put in their contact information so that we can reach them if they've got a problem. So not every problem or every inquiry comes in through email or a phone call. Sometimes it's going to come in through a survey, and people can pick that way. And so next slide, please. So where can you find the surveys? So they're always available, as I mentioned, at medicaid.md.gov and nevadamedicaid.md.gov, and we distribute it monthly through social media when we have it. You can see in the upper right-hand corner there, that's one example of, hey, tell us your story. And we get a lot of responses that way. People love to hear us ask them to tell us their Medicaid story. It's the same as me going to the hairdresser and telling people I work for Medicaid, and they're like, "Oh, wow, you work for Medicaid? That's great. I had this huge problem. I didn't know what it." One of the stories was a guy who was in a play, and he had to do the splits, and he tore his hamstring. And and the doctor told him that he had the best insurance possible for his problem, and which was Medicaid. But that was one of the personal stories that I heard when I was out in the community. And there's tons of stories like that whenever we post this on social media or send it out through email. And then direct to members. So in every message that we send out over listserv, which is direct to providers, members, there is an opportunity for people to tell us their story. And sometimes we highlight that specifically and we say, tell us your story. And that listserv is huge. It's by far the largest in the state by over 400,000 people. It's 620 some thousand, I think, right now. And then we send it out over the app as well, the NV Medicaid app. And then we also post it on flyers too sometimes. Next slide. I think this is discussion part. Yeah, so you can see some of the results here. 5.3 satisfaction. We are talking about ways to get this out more broadly, because when we don't promote it as tell us your story, then we can end up with more negative stories, or we're not getting the full spectrum of members, and the ones that call us, for instance, and are really happy with the service that they get. Maybe we can promote it to them in some way or another. So we've got a broader section, and you can see that there's not a lot of responses there. There's 311 or so, and we've been promoting this for 2 years or so now. And we most recently have posted it on our website. So I think we're getting some new responses in that way as well. I'll turn it back over to you for the discussion, Ann.
Thanks, Kai. Yeah, really helpful overview. So I know it's hard to put on our past brains when we were thinking about the survey from about 3 months ago, but would love to get your feedback. Is this kind of what folks had envisioned? What could we do to continue to improve it? And any ideas on how we can spread the word? We know there's a lot of survey fatigue. I know I get asked to complete a survey. It feels like every day for a bunch of different things. So how do we make this useful for when folks really do have information to share, we can collect it? So Azraella, I'm seeing your hand up first.
Hi, thank you for taking my questions. Azraella for the record. Thank you, Kai, for presenting that. You presented on member satisfaction survey using a QR code. My question is, does QR code / links work on all accessible avenues? I know that it is frustrating to seek information and find a broken code or link, and having someone to check on these codes and links and monthly maintenance updates would be very helpful.
You want me to address that, Ann?
Yeah, that'd be great.
Yeah, they work on mobile and on your computer. So those are the two modalities. And when we send it out over the over text message or over the app, they click on it and it opens up the form. It's an MS Forms, Microsoft Forms platform, so it's secure, and Microsoft Forms generates the QR code. And once it generates the QR code, that QR code never changes. I think that QRs generated in other ways and links generated in other ways can often be a problem, but with the Microsoft Forms, it's not. It is perpetual, and it never changes. So unless I erased the form for some reason, which I would never want to do, it would remain live forever.
Thanks for clarifying that, Kai. And my second question is, instead of a multiple choice to question 2 that you showed us in your presentation, you could open the queue to check boxes and/or all applies. I think that would be really helpful for good feedback.
Yeah, that's a really good point. I think the circles mean that it is multiple choice and they could only pick one.
Right.
And so that's a great point. I'm going to go in there right away and fix that. Thank you. And I have a feeling that, let's see. Yeah, you're right. The response rate there was pretty low. So I think that might be the reason why. So thank you for that feedback. I'll fix it right away.
And then I wanted to highlight that tell your story is a great idea on the flyers.
Nice. So tell us what you mean by that. Are you you're talking about like a quote on a flyer or what?
Well, so a lot of organizations see surveys as a negative response feedback, but highlighting positive responses shows that Medicaid is trying their best.
So
and we can
maybe
display that on the flyers saying like, this member experienced Medicaid in this way, and so can you, you know.
Yeah, so maybe that story that we showed earlier about how Medicaid had changed their life, and then tell your story. And I think in Washington state, they put it up on billboards, and they've got a really rigorous method where they're putting somebody's face with their story. They run background checks on people. It's an expensive process for them, and we do it much differently, where it's, hey, you can anonymously tell us your story, and as long as it's not going to identify you, then we can share it.
Yeah, and commenting like if you mentioning that when you tell your story, it can be publicly known, or and consent, you know, verified consent. Like, let us know if you're okay with us sharing your story. I think that would be helpful. And then I guess my last question is, I, as a member, have had concerns accessing private health information in my past. And I guess after so many years, that access gets updated, those health records get updated, and all that information gets deleted, given our transfer to electronic records. I find that is a huge concern when addressing confidential health information that needs attention, immediate attention. So I'm not sure how we can look at that and solve that as a concern.
Yeah, Azrael, I'm happy to take that piece. I think in general, the state is always trying to we meet all state and federal privacy requirements, right? So there's a lot of really strict rules and regulations around protecting health information. What I'm hearing from you is it's about protecting it, but also making sure it's accessible to the people that need it to make medical decision. Is that fair?
That is fair.
Yeah, so I think that's the piece that the state is continuing to work on. How do you share information between doctors and between, different providers to make sure that everyone's in the loop, but do so in a really secure way? We have a kind of health information exchange that's intended to do some of that right now. I think there's always ways we can improve that. And so I imagine lots of work to come on that in the years ahead, but that's definitely a priority for us to think through as well.
Especially if the patient is requesting the information, I think they should obviously have access to that.
Yeah, absolutely. Agreed.
Then just really quick before we move on, Jessica, I did see that you were able to join online. I want to make sure, if you had any questions or around this agenda item.
No, not yet. I'm just following along with.
Okay, great. Thank you. Just want to make sure
Jessica.
that we didn't forget about you. We saw you jump in.
Thanks for being here. Good to see you.
I'm sorry, I was a little bit behind.
No worries. I was too, so you're good. Grace, do you have something on that?
Yeah, I do. Thank you, Kai. I have to say it's really nice to have a little bit of a good giggle, a little relief there in a meeting, and I appreciate that. So this was fascinating to me because this is definitely a different side of a member survey than what I was thinking, but I actually really love it. I do love that this is bringing out positive stories and tell us your story. And I do, is there a way, what I was thinking was some information that I would love for us to have in order to inform, how we improve things that such as like specifically, like, do you have a primary care provider? Do you have access for that? Do you have to wait, how long do you typically wait is for, and is it, 1 month or more or this or that? And like, do you have access to the specialists that you need? Or do you ever have to travel for the specialists that you need? And maybe how far might that be? So, those kinds of things where, and also specifically when we're looking at in other areas, we're looking at like workforce development and workforce number improvement. It would be really great to have, which types of providers do you not have in your area, right? And so Kai mentioned that you could, even filter these by zip code. So then it just feels like that would be a great way for us to be capturing that data of, okay, in this zip code, they do not have any physical therapists or primary care, this kind of a thing. So I was thinking more in kind of a little bit of a data aggregation kind of term. And so I wonder if the title of Tell Us Your Story, I really do think that's powerful, and I think that's really important. And I kind of want to say for the record that my experience with Medicaid, given my daughter on the Katie Beckett eligibility option, honestly, Medicaid I don't have Medicaid, but my daughter does. And it is what has kept her alive for 10 years, right? Our experience with Medicaid is very, very good, as well as my experience with leadership and, folks within Medicaid, like they'll have it together. And it's great because I tell people that I promise you the people in leadership that I work with are always very open to figuring out how they can help and fix things and get at the source of the problem. So just my little soapbox on that. But
Submitted in the survey.
yeah.
Can I take that really quickly?
Please,
Ann?
yes.
Well, I
So-
think, great. Wait,
Go
Kai,
ahead.
1 second. I think Grace just has the second part of the question and then.
Well, yeah, just that little piece of, can it be marketed in different ways, but it linked to the same survey? So like, I would love to see what exact questions are within this, and have a little maybe input on that. And does there have to just be one, right? Could there be another one? And having the Tell Us Your Story as the premise for positive, because we know we're going to get more positive feedback on that. But do we also want to have one that's maybe called still in a good light, but like Your Voice Matters, or like, tell us how we're doing, or be part of the discussion? If you let people, if you frame it in that, we want you to tell us how we can give you, how you can have the very best service, like be part of that discussion, right? So just a little bit of a tweak on that.
I like that. Yeah. Kai, you want to speak to that?
Yeah, so one of the things that we really need to consider is survey fatigue. So we need to keep that in mind, and that's why we've kept it to 5 questions. And the hope is, if we're saying something like, we could adjust this question with the check boxes to, tell us, if you need more providers in this area, but and an experience survey. But I think that what we're doing, because a lot of that data, regarding if there's access to a particular type of provider in a particular area, we probably know that or have it somewhere. And what we're looking at now is the disconnect. So people not knowing that they have a provider in that particular area, so that we can identify areas where we need to improve our communication. So if people say, yeah, I don't have any access to a pediatrician in my area, then we can look at that area and go, yes, there is a pediatrician. Where's the disconnect here? And how can we fix that? As far as an experience survey and adjusting the questions, and send us, ideas for questions that we can put in here. I really like the idea of workforce development, access to specialists that you need. How long is your wait time? We could compare that, if somebody's saying, yeah, I have to wait like an hour or whatever it happens to be, and we know that we're getting reporting that says it's 10 minutes, then there's some kind of disconnect there that we can look into. So I think that it can be a real powerful tool in terms of the members' experience versus the data we have, and do they match up? Do they align? And can we share some of that information in the survey as an educational tool? So we could say something like, our data shows that members on average wait, a day for an appointment or whatever it happens to be. What's your experience? And so then they're learning that most members are waiting a certain amount of time, and that's using a survey as an educational tool as well.
Yeah, I appreciate that. Seeing a couple hands up, just super brief addition to that, and then we'll get to you all. What I'm hearing is maybe let's tweak the title of this, tell your story right? So I love, Azraella, your idea in the chat, and welcome others to kind of noodle on that piece and give us some feedback. I wonder if we can include, in the spirit of keeping it short, but getting the data that you're talking about, a question on, have you been able to access the healthcare services that you were looking for? Tell us your experience, if so or if not, right? Like kind of keeping a little bit general. I will also say, we are federally mandated to work with an external review organization to conduct patient kind of experience surveys at kind of a random sample. So we're going to get a lot of the like, how long was your wait time and what is the specialist access? Like the really granular stuff we get through that CAP survey as well. So I think there may be multiple angles, but I really want to make sure when folks are answering this, we're getting that information. So what are your thoughts on that? More tweak the title and add one general question about access. What do you think?
Yeah, I think that makes a lot of sense. And I think I would love to see those CAP surveys that you're talking about, because where I'm coming from, because I work, managing family navigators within complex needs. I have people come to me even just out of coffee because they know that I'm within that world, and they'll say, I can't get this, I can't find that, I don't have this provider, and so we're hearing the other side of the story, the people who aren't finding them. So Kai brings up a good, point. How much of that is communication, of them not knowing what they could have that is available, but how much of that actually is, the lack of providers. I know, myself, I haven't been able to get a physical therapist for my daughter for 1.5 years, but Medicaid might actually tell me something different when they look, because it doesn't actually quite fit up, right? So there's just, that's a great point though. How much could we actually satisfy here? We do have that, and it's communication. How much is truly like, but that is I think one more question, you bet. And I'd love to see the exact questions, and then also those other ones that are sent out periodically. And I won't take up any more time.
No, that's really helpful feedback. But yeah, Bill, I saw your hand, and then Killen. Yeah.
Do you want to go first?
You can go first.
Okay, well, Bill Sims for the record. I just wanted to ask something in regards to question 3 on the survey, and saying, what can we do to improve? Because what if it's a question that requires something like a policy change or a legislation change? Because when you interviewed me last year, I told you about my teeth situation. Most adults aren't covered for Medicaid, for general dentistry, unless it's an emergency. And I know you say you guys are trying to see if you can have funding to help with that. But so what if it's something that has to be done that, might take a year or 2 or 3 potentially, and that person gives that feedback, but they might feel ignored? How would you be able to handle that and saying, we, are wanting to improve, or we're going to try, and just make sure that, that they're not feeling ignored, and just saying, giving these surveys back and constantly
Going
getting
into a black
nothing.
hole.
Yeah. So at the very least, just so that they're not yelling to a black hole and not being given any kind of response back, because maybe nothing can change, or might take a while to change.
That's a really good question, Bill, and I appreciate that. on the dental side, effective July 1st, you can get all dental procedures, which is very exciting. So that's the good news. That's huge. But I hear you, and I think that's a really good point. So maybe, Kai, we can think about, I know this is an anonymous survey unless you choose to put your contact info. So maybe we can phrase that contact information specifically of, if you'd like a response to your suggestion for feedback, put your email here.
Yeah.
And our team will review these over time and get back to you, and we can get that update. Like, we
Yeah.
appreciate the dental idea. We're working. It may take us a couple of years with the legislature, but we'll keep you posted on what that happens.
Yeah.
I totally hear you. No one wants to feel like you're shouting into a void. And so maybe we can be really clear on the question of how to communicate that piece, Kai, about if you want to hear a response to your feedback, list your email here. And then we can think about how our PIO role and others can support with answering some of those questions. Yeah.
You know, and just a quick direct comment on that. Thank you for bringing that up. I was recently in a webinar regarding engagement and public and family engagement. And one of the key things that was mentioned is how important it is to show your engagement participants the sort of the results, so that feels like it isn't going into a black hole. And maybe some of that is just very periodically sort of publishing that or doing a social media post or that goes back out to those email addresses that emailed, if they're able to, saying, hey, here's what's come up in the last 6 months. And then I think because you also have some really cool stories that come out, I love the idea of featuring those happy stories sometimes too on social media.
Love it. Kehlani?
Yes, Kehlani Queen for the record. Under discussion, what other ways can we distribute the survey? I was thinking it would be good to get new Medicaid recipients who have been on Medicaid for about a year or less, emailing them, texting them, or calling to let them know about the survey, because they have the most recent experience from other insurance plans. So they're able to compare their services and providers, with Medicaid and their experience with other insurance plans. So they'll have something to speak about versus somebody that has been on Medicaid for 5 years, 10 years. We may not be able to kind of compare as much as somebody who is newly on Medicaid. So I think that would be really good on that aspect. And the other thing would be sending out patient surveys to people who are going to certain hospitals or providers, and just randomly saying like, okay, this was your first time with this primary care provider. How was your experience? Please rate the provider, your experience. How accessible was it? Did you have any issues finding this provider or hospital? And I think that also brings some more accountability as well for the Medicaid providers and Medicaid hospitals that accept Medicaid. So we're able to kind of figure out people's patient experiences and see how they feel, if their level of care was the same as it was before when they had another insurance plan, or if their experience is night and day with Medicaid versus another insurance, just to make sure, because their bad experiences may not be a Medicaid issue. It might just be an issue that, their provider wasn't honoring them as a patient. So
Those are two great ideas. Your survey and research mind is very clear. I'm really grateful for that. And I think an idea, Kai, to kind of target newer members, like, hey, welcome to our program. You've been part of the, Medicaid for, 6 months or 8 months. How's it been so far? Right? Would be a great way to kind of tee up, tell us your story, and then drop the link in right there. So we can think through ways to kind of target more specific groups of the population in that way. And then on the provider survey, I think you're spot on. I think that's something we'll continue to work with our managed care organizations on as well. We also do secret shopper calls where we'll call, we meaning our external review organization, that's kind of a neutral party. They call providers and they have a fake Medicaid ID number and they say, hey, I'm calling to make an appointment. How long is it going to take, right? And the provider may say, oh, we have appointments next week to us, but when someone calls, they say it's 6 months, right? And then we can kind of evaluate that. So we can think about ways to include the patient-facing surveys as part of that too. So great feedback. Yeah. Cool. I saw Jessica's hand up earlier. Jessica, do you have something you wanted to add to this?
I was going to ask about the dental, actually.
Yeah, please, go ahead.
you were saying that all services would be available, because recently I had my mouth worked on, and I got denied. They said that only one time per year the type of procedure I got was allowed, but they didn't finish what they were doing, so I was trying to get more clarity on that.
Yeah.
Exactly.
Absolutely. If you want to reach out to our team, we can take a look at your specific situation. So maybe you can drop in our care coordination inbox and we can kind of figure out who to connect with at Liberty on that. But yes, effective July 1st, we've expanded dental services available to adults. So before, adults couldn't get cleanings or cavities filled or kind of diagnostics for root canals. And that's all going to be available now. It's going to be $1,000 per year of dental coverage per person. So I'm hopeful that means your situation may be a bit different in a couple weeks. And I know how important it is to get the dental care that you need all the way completed. So if you'd reach out to our team, we'll drop the email address in the chat here so you can send them an email and we'll connect and figure out what the next steps are. Sound good?
Thank you.
Yeah, and Azrael, I'm seeing your comments in the chat about challenges for access. Absolutely, we appreciate how that we don't have enough providers right now, likely for all the demands that will come with the new services. Liberty Dental has been really expanding how many providers they have contracts with, which I'm hopeful will be helpful. But if you're continuing to run into challenges, please reach out because it's something that we want to continue to audit and make sure folks are meeting our contract requirements. So that is definitely something we want to hear about, and I'm sorry to hear it's been a challenge. Yeah, Bill.
Okay, maybe this is kind of unique, but Bill sent for record. So given I'm in the smaller minority of people in Medicaid because I had dual coverage, will I still get that one? So would I be able to use that even though I have dental implant?
Yes.
Oh,
Yeah.
cool.
Yeah. It would be more about kind of like the regular cleanings and all those pieces. And then if there's, more complex things needed, that's kind of evaluated by the dentist.
Gotcha. Okay, cool.
Yeah. No, we should have given a whole little celebration on that one. I'm super excited.
Yeah.
It's like one of, and CMS approved it like 3 months early. It's been a big win all around. So, but it's, our mouths are part of our whole bodies and we should treat it that way. So it feels like a long time coming. It's exciting. All right, well, this has been an incredibly helpful summary and kind of feedback on the survey itself. So Kai, do you feel like you have what you need in terms of feedback on this or any further things you want to add before we close here?
No, I don't have anything.
All right.
That was great
Well,
feedback.
yeah, no, this has been such a productive couple hours. So thank you for you all, and Jonathan, we'll turn it to you for our next agenda item.
Yeah, and I agree. I feel like it was really encouraging to see how much is already in place. And you obviously on the back end have really deeply understand and have all that tech there. So that was awesome to see. Okay, and we will be moving on to our agenda item number 10, looking at that MAC annual report. This was emailed out. And this was, Jonathan, I'll pass that over to you.
Yeah.
That you've got
Of course. Jonathan Figueroa for the record. So yes, one of the requirements from this final access rule that was passed recently was for there to be an annual report from the Medicaid Advisory Committee. However, there also has to be, this report includes the topics discussed, the activities and the recommendations, and as well as the state's responses to those recommendations. And so because it's a Medicaid Advisory Committee report, but again, it also has to include sections from the BAC. So the activity discussed within the BAC, their recommendations, and the topics discussed, the state's responses to those recommendations as well. But because we had some crossover from the BAC members on the MAC, some of the things, the recommendations and topics discussed sort of aligned together. And so this first year with this report, what we decided to do was to implement all of that, and it's embedded throughout the report. That way for you guys to see what's going to be included on that final report that we'll be bringing over to the meeting later this afternoon to review and hopefully find.
Thank you. I encourage everyone to take a few minutes to look at or a little deeply.
Hi, before trustee list for the record, I think we'd like to use this time to, review the annual report, have the back members review the report, and maybe discuss any questions you might have, to bring that over to the Medicaid Advisory Committee later on. I know that some of our back members are some of our back members are part of that group and some of them are not. So I think this moment is to kind of, if there are any questions or comments, to kind of discuss those so that our back members who are also members of the Medicaid Advisory Committee can bring those forward and for discussion. And then within the report as well, there is a requirement for the state to respond to the recommendations that were put forth throughout the last couple of meetings. And those are provided already in this draft of the report. See, Azraella has her hand up.
Hi, thank you for taking my question. Azraella, for the record, I saw that the purpose of BAC is to advise the MAC, having available stakeholders during the MAC meeting, and that they have the ability to speak, answering the questions, given that they're experts during the MAC meeting is so important for the BAC members to get their get their questions answered, and also to provide feedback.
Thanks, Azraella. Do you feel like that's happening right now, or is that a suggestion for how we can continue to improve kind of the format of it?
I think to improve the format, it kind of needs to be more interactive between member and provider. Right now, it's an open discussion with members. Like this is open discussion with the BAC members, but having experts on the call is so important, and having the opportunity for those experts to answer those questions.
Yeah, I appreciate that. So I think continue to welcome your feedback, especially in those MAC meetings. If there's particular questions that you feel like would be good to have expertise to answer, we're all ears. So send us examples as those come up. Yeah, thank you.
Yeah, like during the MAC meeting, though, when we, so I think we included that the BAC member summarizes the meeting previous for the MAC meeting. I think it needs to have a little bit more structure. That's all I'm saying. Thanks.
Okay. Yeah, I appreciate that feedback. We'll keep thinking about that on our end.
Grace Larkins for the record. I think this first year of the BAC and the MAC has really been a lot of, it's been educational for us primarily because there's so much changing and there's so much happening. I'm a little bit, it's discouraging that some of our members term out after just 1 year. And so I know that was in the legislation. And my question is, what do we mean by some? Because I know I have a 2-year appointment. And what is that? Is there a number there of
Yes.
How does that work?
Yeah, Naheem Flores Rosilis for the record, part of the BAC MAC support staff. That was part of the legislation. Within the legislation, it wrote these members have 1-year terms for the first year, and then these other members have 2-year terms. And that was in part to make sure that we're not turning over the full BAC and MAC each, whether that's the first year or the second year.
Mhm.
And so that way we're only turning over half of the MAC and the BAC.
So it's
This
a
first year.
50-50?
It's a 50-50.
Gotcha.
Yes.
And is
Yeah.
2-year terms for everyone after the first,
Correct. And then going forward, it will just be 2-year terms for everybody because everybody is already kind of, structured in their 50-50. So the members coming in this next year, they will have 2-year terms and won't obviously expire at the same time that some of the other folks who are currently already on a 2-year term going into the second year will term out.
Okay, great.
Yes.
And so just to kind of finish off my thought there was, yes, I feel like this first year we really had a lot to learn in all of these major areas, but I think today was for me a really exciting and robust meeting because I felt like not only did you kind of address and bring to the table some of the things we've asked about, such as the member survey, and also kind of giving us, after all of these months of getting to see where things are moving and changing, but giving us an opportunity to look kind of directly at materials and what that's going to be like as it faces the community. So, it makes me excited for the next year coming forward. That said, I really wish I could take with us a couple of the folks we're losing, but I absolutely understand the legislative piece.
Yes, and Heidi Flores, Wesley List, for the record, just a reminder that members who do expire this coming end of June, although you cannot serve consecutive terms, you are always welcome to reapply later on. So if you really liked doing this, being part of the back of the map, you can please do apply in the next coming years as well. And I do totally agree that I think the first couple of meetings were kind of more learning for you folks, and this meeting was just such a great conversation, more recommendations, more just like, it was like a working session almost, is what it felt like. And I think that's what we kind of hope to take with like half of the members continuing on to the MAC and the BAC groups, is having those more kind of the experienced members that have been part of this for the last year, and trying to make sure that we're not teaching a whole new group this next coming year. So yeah, very excited for all that's to come with the new group and everything. So
yeah, being at the forefront of all of the updates, because I know that y'all are receiving guidance on this regular basis as well. So
yeah, Bill.
Bill Sims for record. Yeah, I just want to say on top of what Grace said that, been doing this for a year now. I really appreciate everything I've learned from being a part of this with you guys in both boards, because I've been able to actually take what I've learned over the last year and educate other people on it, because it's amazing how little people know if they're not directly intertwined with Medicaid. And so to actually be able to point out that, there is actually a lot behind the scenes that you guys do to make sure that people on Nevada Medicaid are able to get the care that they need, really, I think, does help a lot of other people either learn or go out to research and teach themselves on how, Nevada Medicaid actually really works for everyone, because it's not just as simple as saying, but you get this and this for having to do nothing, and they all, Nevada Medicaid pays for it, just that simply. So I'm just glad I've been able to be a part of this and help educate other people.
Well, we appreciate you doing that, Bill. Just spreading the word and helping kind of answer people's questions on your own time. We're really grateful for you to do that. So thank you.
Kelani Queen for the record. I think everything looks amazing. I think you guys have been very intentional and listening to all of our concerns. So thank you for giving us the space to be able to discuss the concerns. And I'm excited for the changes that we're able to implement and updates that we're able to make. And I'm really excited to hear about the dental coverage. That's a big win, especially with everything going on right now. I'm hoping we have some more wins for like the mental health aspect in Nevada, because we're rated so low. So hopefully we are able to continue with the areas that really need that support. And again, thank you for this opportunity.
Thanks for being here. I appreciate that. Yeah, the mental health piece is a big passion of mine too. So we're gonna get there. Even if it's just like 48, that's gonna be a big win. Well, slowly we'll get there.
Any other members online have any feedback for us?
I appreciate you guys allowing us all to learn as well. It's been really informative and I appreciate it a lot. Also, if I I can send like other moms from the Jeremiah program towards you guys, right? To apply for the BAC as well.
What was the question?
Say, you cut out just very end. Can you repeat that last piece one more time?
So I have, I'm part of something called the Jeremiah program, which is a nonprofit have you heard of it? Yeah.
I have. I think we had a chance to talk about that
Yes,
last time I saw you. Yeah.
That's right, that's right. Well, I was just thinking about letting other moms know about the BAC and helping, maybe having them
Yes.
apply.
I would love that. That'd be great. We'd really welcome any and all applicants from the Jeremiah Project group and anyone else that you know in your life. So I think we sent out a call for applications recently.
Yeah,
I'm hopeful
yeah.
that you all got that too. So forward that around. And if folks have questions, please send them our way because we'd love to have their perspective.
I believe Jonathan is going to throw in the application in the chat.
Great.
Yeah. Thank you.
Thank you.
All right. Does anybody else have any input on the MAC annual report this time?
Questions on formatting? Naheedi Flores Socialist for the record. I know at the last meeting, we brought kind of just like, hey, this is the format we're thinking for this report. Again, it's the first year that we have written this report in with the new Medicaid Advisory Committee and now the new Beneficiary Advisory Council. So this is a result of that. So if there's any feedback on formatting that we can maybe make changes on for next year or whenever, please let us know and we can talk about that further in the MAC as well. I see Azraela has her hand up.
Hi, Azraela for the record. I know that in the previous MAC meeting, we made several recommendations, including mental health, access to care. I believe I made a recommendation to have a more inclusive vaccination program. I know we have mailed out information for new moms to get their infants vaccinated and deadlines and start dates on when to have the doctor's visits. However, I had mentioned in a previous back meeting that the jargon for those checkup mailing notices are confusing, and there's a lot of information that should be reformatted. So I just wanted to note that my recommendation, I don't think is added there.
Remind me on that one. Was that the DPBH mailer?
I think, was that DPH or maybe one of the MCOs? I don't know.
Yeah, Azrael, I'm trying to put what month was this? My March brain back on. I believe that mailer, was that something that, do you remember the source of that one? Was that from a managed care organization or was that from more of the state itself?
I think it's through the checkup, Nevada checkup. So that's still through the Medicaid portion, but there's like a copay for semester or quarterly. But I think that should apply to all Medicaid members, is a vaccination, more inclusive vaccination program, and mailing out notices that is understandable and helping our kiddos get vaccinated on time and to stay in school.
Yeah. No, thanks, Azrael. I appreciate that. We'll track that down and see if I can find it. It's not ringing a bell for where that's coming from on our end, but there's so many different programs and stuff. So we'll definitely, I think we can reflect here In the communication section, I think about benefits education, we can maybe note the value of having clarity on all benefits communication and doing it more broadly. Because I think that's a really key point there. And then for this one specifically, we'll keep digging in and seeing if we can find that one. So thanks for the reminder there.
Yeah, I believe I sent Jonathan a correspondence with the what I was talking about in the notices. I highlighted the notices, what I thought was confusing and the jargon, and added some or advised some changes, but it was some time ago and I don't think it was addressed. But then last in the MAC meeting, I kind of wanted to address that and then recommend that we do include our vaccination program because it's so important, especially given that other states are opting out of doing that. And I think it's really important to put our best foot forward in that.
Yeah, thanks, Azraella. I appreciate that reminder, and we'll track that down. And if we still need more information from you, we'll reach out. But I agree that I think the overall goal of these two committees is to continue to refine the way we talk about both our benefits and also public health initiatives. And so making sure that we're really aligned on that will be key. So thanks for flagging that. We'll make sure to follow up there.
Thank you.
Thanks, Larkins. The only thing I think that I can see that it would be nice to have added in here under our recommendations, what is related to the the member survey, as we talked about today. So it was great that we kind of reviewed that, and that it kind of seems like there might be some tweaks, and we may be able to use that as a way to get a little bit more in informing how we can help with access, improve access and things. So it would be great to kind of have a continual discussion on what we're seeing in surveys and public feedback on things from families, and whether gaps that are coming to the surface.
Yes. Now, Heidi Flores Rosilas for the record. I think for the purposes of this annual report, we were trying to get recommendations from the last 3 meetings.
Oh,
and so
gotcha.
therefore, the recommendations provided in this meeting, obviously we'll be working on it as we get them,
Great.
but will be included in the following year's report. The federal legislation didn't really specify what pieces should be included, or the timeline, I guess. Just that it needs to be submitted. They have to be finalized July 9th, 2026 and posted within 30 days after it's finalized.
Okay.
So
Thanks.
but yes, we'll definitely be including that.
Great.
Everything from today's meeting.
Okay. Does anybody else have feedback?
I think she answered my question, Kelani King, for the record. I wasn't sure when it was going to get submitted. So June 9th or July 9th?
So has to be finalized by July 9th, 2026. And that we're hoping to do in the Medicaid Advisory Committee later today. And then will be posted within 30 days of finalizing.
Okay, perfect.
Share it far and wide. Brag on all the work that you did to inform our program.
It'll be posted on our webpage.
Yeah.
Yes.
Yeah.
I guess I would like to ask one more question. I see on here that under recommendations, it shows that it's right at that top, page 7, just at the bottom there. Members advise that notices and reminders be available through the Nevada Medicaid mobile application, regardless of whether those beneficiaries are enrolled in an MCO or under the fee-for-service delivery system. So I know just some clarification on that. I believe I asked last time. So is there a Nevada Medicaid mobile app that people are using?
Yes.
And do we see engagement on that?
Yes.
People are using that. And how is that, how does that relate with Access Nevada or what's going to be Medicaid Express? And are those, sorry, and one other question, when we use the word portal, that makes me wonder about, like Azraella brought up, transmitting and sharing, private information, is that portal, does that have the, capability to have actual, shared documents, things like that?
Yeah, all great questions. So yes, we have an app right now available on the App Store for iPhone users and the Android App Store. I'm not an Android person. I don't know what that one's called, but we have seen the Google Play Store. Thank you. So we have seen good engagement with that. It's a little bit of a twofold system. So the Access Nevada and Medicaid Express are for people renewing or enrolling in coverage. And that's totally a separate kind of source of information than the app, which is for current members. That's where you can note changes to your life situation. You can pick an MCO. There's different kind of components to do on that app. And that is secure. There's a process to validate your information and make sure that that's saved correctly. There isn't health records on there, but it's more just other PHI, like your name and your address and things like that. So I'm sure there's plenty of ways we can improve that app experience. And if that's something the group is interested in covering in future meetings, we could totally do that.
So thank you. Thank you for that. On that note, I wanted to just point out again that the reason I don't know about the app is that I'm unable to create an account for my child who's under 18. And that actually even goes for Access Nevada. We've tried getting on there. And I'm wondering if that is because typically the head of household would have their own account and be able to list their children. And maybe in the case where my child has it, but I don't. But I know I've mentioned that before, but I do think that if the application is available, it would be great if all of the members could have access to that, including if it's for a child or under 18.
That's great feedback. I am not going to try to speak tech here, but I imagine your hunch could be correct and why that's the case. And I imagine there's a way we can find a workaround. So let's kind of tee that up with our IT team and maybe they come in and present about kind of what the app looks like right now, what we're using it for, and then we can tee them up to speak to Grace's question and what that would look like to address. Yes. That may require a broader tech build, which is resources and money and all those pieces, but we can think about what that looks like.
Great. And I see that Kai has posted that billing information is in the app there, even showing a chart for that.
So. Yeah, Kai, we can't see the chart from, or at least my eyes can't see the chart from here. Would you mind just kind of verbally narrating what that's showing at a super high level?
Yeah, there's 94,000 people have downloaded the app. That's the total number. MCO members 47,000 and FFS members 46,000. The reason why it gets higher for FFS is that they don't have an app through their MCO. So MCO members tend to download the app from their MCO and don't download the NB Medicaid app as often as FFS members. So the chart, covers from in 2025, we have about 1,500 new members every month that have downloaded the app.
Thanks, Ty. Great. And then Jessica, I want to make sure we get you the right link. Is that community partners to sign up for the BAC, or is it for outreach in general? Or help me understand what you're looking for so we can get that for you.
For the outreach, people who would be willing to help get the information out.
Oh, so the last question of Kai's survey. Yes. Kai, what would be the best way to connect Jessica with kind of the Medicaid champion information?
What else?
To be able to complete the, I'm sorry, I'm not following. You want to, go ahead.
On the it said about having community partners that would be willing to help get information out to people as well.
Yeah.
And,
so you can complete the survey itself and put your contact information in there, or you can also join the community partners listserv, which is where we send out information that we can hopefully get our partners to redistribute.
Okay. I'm sure how to do that. Thank you.
I'll put the link to where you can sign up for the listserv in the chat.
Yeah. Okay. Thank you.
Thanks, Jessica.
Thank you. I think that actually really clarified something for me that I've been wondering for many months is I keep hearing about the app or the portal, but the fact that most members are going to have their MCO portal. It's just so that really lines it all up for me. It made a little more sense. Okay, I know that we have, it's still quite a bit to get to. With our, yeah, a lot has happened already, roundtable style, I feel like, but what do our next steps need to be on this? Because do we need to actually have any kind of vote moving?
So it'll be done in the
In the
Highway Forest Roasting List for the record. It will be done in the Medicaid Advisory Committee. Yes. There will be room for discussion before and then the vote.
All right, so again, being kind of mindful of time here, and I want to make sure we, if we have any public comment, we can get to that as well. But we can move on to agenda item 11, our roundtable discussion. And this is a great time to get in any of those final comments or questions that you had, as well as things that you may want to see on a agenda, put on an agenda going forward.
Azriela?
Oh, sorry, I didn't see that. I didn't hear that you guys called my name. Yes, so I have some advice under the adults considered under to be determined. Given the increased violence we've seen in many states across America, and the given additional restraints to access to healthcare, I believe we should include in the work requirement exemption survey for Medicaid applicants a two-part yes or no question of, I often have intrusive thoughts on harming myself, yes or no, and I often have intrusive thoughts on harming others, yes or no. And that would be automatic exemption for needing help, severe mental health needs, and also keeping our community members safe.
Yeah, thanks for that, Azraella. I appreciate the creativity of how do we really ask the questions in a way that feel really resonant with our patients. I'll have to take that back to our team and figure out if we can do that. There's a lot of very particular requirements from the federal government about what we can and can't ask to exempt people. And I'm not sure if that would count towards the serious mental illness category, but if it does, I definitely appreciate the suggestion. So we'll take that back and see what we can do on our end. But share your goal of, first and foremost, the goal is to connect people to the healthcare that they need, and the mental health care inclusive of that. So thank you for your kind of continued passion and commitment to that. Agenda talk? Yeah.
Please. I know that I do. I am wondering if we can get an update on where SB 185 is sitting from the last legislative session. That's the paid family caregivers for children with complex medical needs. I was under just an overview of where that's gone. I have a feeling there hasn't been a lot of movement on it because there's been so many other things going on, but it is still something that's important.
Mm-hmm. We can get that on the agenda for sure, and we can have the team leading it. The effective date in the bill is, I believe, January 1, 2028. It's pretty far out in terms of the process with CMS, and also to make it cheaper, candidly, that's what the bill author decided to do. So that one is, you're right, it's a little bit delayed compared to some other bill implementation, but our team is working on the right way to approach it with CMS and move forward there. So we'd be happy to come and give an update on that and get initial feedback too. I know that's a top one of interest for a lot of people, so happy to speak to that.
Great. I also would love to take a look at the MABID application, kind of usability and that process. That form in itself can be really difficult for families, that MABID and SNAP. There's some really confusing kind of language sometimes. And that is also the application that's used for the Katie Beckett eligibility option. And it would be great if we could there's been some other work going on trying to look at the process on that, but just being able to actually kind of take a peek at the whole thing as a group would be great. Like, doesn't necessarily have to be the very next meeting, but
Yeah, I like that suggestion, and I think we can, I think that will align with some of our modernization efforts, that we're doing on the eligibility front for both the Health Link and for the existing system. So we can take that back to the team and figure out when that would make sense. I will caveat the eligibility and application process is really prescriptive from the federal government. So we have less leeway in how we can ask some questions, unfortunately, than probably we'd all like. But I think getting feedback regardless, and then we can take it to the lawyers and team to figure out what we can and can't shift. We'd be happy to do that. So definitely appreciate there's plenty we can do to make that process better.
great.
Okay, I have a question as well, but I see Azriela went first, so I can wait for her.
Thank you. Yeah, Azraeli, go first.
Thank you for letting me ask a question first. So I have a question. You had mentioned in the survey or for work exemption requirements for adults, you mentioned ER reporting substance abuse. I was wondering what's Medicaid's approach to the initiatives to accessing urgent care needs for those patients. And for one, it will help reduce homelessness and reduce that mental health conditions being exasperated. So I was wondering what Medicaid's initiatives are to addressing those urgent healthcare needs when they are documented by the ER.
Yeah, absolutely. We can talk about kind of what I'm hearing is mental health crisis support, and then also substance use referrals from an emergency setting to the community. So we can definitely have our team talk about what coverage options are available there. Mm-hmm.
Especially if the person who or the patient who is reporting at the ER that they are an addict and are experiencing homelessness, I think their mental health is like their stress level is probably really, really, really high, and it becomes an urgent need, especially if they're ending up at an ER. So I'm looking forward to the Medicaid's initiatives on addressing this problem. Thanks.
I appreciate it. It's a really important and vulnerable patient population that we can all continue to serve better and support better. So happy to think about how to do that.
Shalani Queen for the record. So I'm trying to circle back to a few hours ago for the new work requirements. Yeah. So I know I brought up the incentive for companies to hire Medicaid recipients and Medicaid beneficiaries. I think if they hire Medicaid recipients for a year and full time, that could help with Medicaid recipients no longer needing access to Medicaid. So that could be a financial incentive that could be helpful. And I think the statistics of being employed at a company for a year, you're probably going to stay there a little bit longer. Yeah. So I think that could be really important. And then some type of work program, maybe with employee NV or something to help Medicaid recipients get work training. Maybe they just haven't, if they're 18, 19 years old and newly on Medicaid, maybe they haven't had work experience and they just need some training and education on how to remain employed and how to navigate the workforce. So I think some type of training would be really beneficial for them as well.
Yeah, I appreciate that. And I'm glad that there's already some good resources out there that we can just maybe better connect people to. So thinking about that Employee Nevada program, I think it's exactly intended for that. How do we help people that may not have as much work experience get connected and stay engaged with the system? So I totally agree. And I wonder, would it be helpful in terms of an agenda item, thinking about having some of those organizations come present maybe early next year about like, here's what we're doing, here's what's working, here's where we may need some more support, to kind of think about where may other incentives or information sharing be helpful. What do you think?
Yeah, I think that would be really helpful just so we know what's out there and we can push that out to the community via email or something like that. So people have access to that information.
Yeah, totally agree. That will all definitely live on our website. So when folks have questions, like when they get the notice, for example, if they go to this website, we'll have like, do you need that help finding a job or finding a volunteer opportunity? We'll have a couple of resources listed right there. But there's always better ways to keep sharing that. So I think that will be really key to kind of keep coming back to throughout next year.
Hi, Bill Sims for the record. I just had a question going back to, when you guys are gonna send out the letters to people, you know, letting them know about their qualifications and everything. What I wanted to ask is, if that person does lose Medicaid, because I'm reading that, you know, they will lose Medicaid, but they'll be given a chance to appeal it.
Mhm.
Are they like going to be given amount of time to appeal it while still having Medicaid? Or how is that gonna work? Are they gonna lose it and then they can appeal it, or how is that gonna work for sure? Because it doesn't seem very clear on.
Yeah. That's a really good point. So we'll kind of clarify appeal timeline. We can definitely do that. So at a high level, people will receive this general notice in the fall to say, hey, next year when you renew, things will look different. And then 90 days before their renewal date, they'll actually get the packet where we say, hey, we need info, or you're good, don't worry about it. If we need information and we don't get it by that renewal date, then you have 30 days you will lose coverage, but then you have 30 days to reinstate it before having to, at that point, if that kind of reinstatement doesn't happen in 30 days, then you'd have to start from the beginning if you're able to meet the requirements after that point.
Okay, and then so just
Yeah.
to make sure, because I just feel like this may be, you know, somewhat of an issue for some people. So in that 30 days, are they basically going to be guaranteed they will get response from the state of Nevada, or is there a possibility? Because I know this is going to be a new thing for everyone, so I'm not saying like Nevada has to be able to do everything pitch perfectly, but you know,
That's our goal.
is it basically going to be a given that everyone will get a response within that 30 days just in case, so they don't have to completely start over?
Yeah, it's a great question. And you're right. The state will be required to honor. So if you submit information within 30 days and it takes us more time to review it, you wouldn't have to start all the way over again. It's about when we receive the information from you.
Okay.
So yes, it's a good question. And that's why we need to staff up though, to keep moving, you know, keep our staff really focused on, you know, moving those through the process as quickly as possible. But I think what this is telling me too, is we can be a little bit clearer on, yeah, here's the date, you know, your renewal date is the date that you have to give us information by, and at which point you would lose coverage, but there's an ability to reinstate it quickly if you respond within 30 days, something like that.
Yeah.
Yeah, cool. Great question. Yeah.
Okay, we have a 10-minute warning. I just to sum that up, bring that together, like as Kehlani said, and as Azraela said, for agenda items, I know the mental health as an agenda item to kind of, and as well as I think the work, the work requirements and Employ Nevada, maybe getting on those some kind of a guest presenter as well, like Employ Nevada, and with mental health, like specifically what do we want to learn more about? I think we probably should clarify that. So I just wanted to echo those. I think those are two that's come up before. So that's fantastic. And we are going to have to move on. Azrael, do you have something pretty quickly you can just throw out there so we can still get to public comment?
Yes, just that there is legal guidelines to help patients who are in mental health crisis. However, the current state legislation requires two providers to submit acknowledgement of that mental health crisis. So there's limitations there, and I just wanted to point that out.
Yeah. Yes. Okay. Thank you for that. And thank you for all your engagement. And you have so many great comments and questions. All right. So we will move on to our almost final agenda item with public comment. If you would like to make public comment, please raise your hand or type public comment in the chat, or the last 4 digits of your phone number and your name will be called on to begin. And you will, if you do have comment, please state your first and last name at the beginning. and for recording purposes, and you'll be given 3 minutes to speak. And do we have any comment in the chat?
Kimberly had her hand up earlier. Is there anything you wanted to add here, or we can save that for the MAC as well if you'd like? She's still able to be on. Maybe good. Maybe she had to drop off. Okay.
Okay. All right. Well, I just want to thank everybody for being here and for such a just a great meeting. I'm just really proud and happy to be part of this. And we will adjourn the meeting at 11:54 on Wednesday, June 3rd. Okay, thank you.
Thank
Y'all
you.
Have a great,
Thanks for
have a great rest of your day. Thank you.
Thank you, everyone.
Thank you all. Appreciate it. Right, that was my most fun meeting. And who's staying for this afternoon? You'll be here. You're here.